Welcome everyone to this year's virtual colloquium on school mental health, including threat assessment, school safety, and trauma. My name is Julie Surovich, and I am the Dean of the College of Behavioral and Community Sciences here at the University of South Florida, who's hosting today's event. For those attending for the first time, and there are hundreds of you from all over the state, first welcome, and let me just give you a little bit of background. This is a yearly event where the college partners across our academic units, including the Department of Criminology, the Florida Mental Health Institute, Department of Child and Family Studies, Department of Mental Health Law and Policy, and the School of Social Work, to bring scientific expertise and the community together to discuss issues related to the intersection of crime, criminal justice, and mental health. This year's topic is highly relevant to the series due to the series of school shootings that we've seen across the country. Increased police presence and metal detectors aren't enough to tackle the underlying issues facing these young people. I hope you enjoy the talks and engage in the discussion. I want to thank the organizers who put in hours and hours into programming this constantly changing environment. Thank you all for your flexibility and your willingness to adapt to our situation. My gratitude to the speakers who have agreed to present under virtual conditions. I'm sorry I didn't get to meet you and have you on campus. We'd love to host our speakers maybe another time. And our incredible sponsors, my gratitude to Drs. Carl and Cynthia Hawkins. They have been supporting this colloquium for years, and we all appreciate their generosity and friendship so very much. Carl, Cynthia, I wish I was sitting next to you this year. I'm enjoying this right with you. Now, today's program will be moderated by Nikki Zen. Many of you know Nikki. She's an instructor in the Department of Mental Health Law and Policy here at USF in our college. She teaches courses in the behavioral health care major. She received her specialist in education degree in curriculum instruction with an emphasis of school psychology. Ms. Zen served as the executive director of the multi-agency network for students with emotional and behavioral disabilities and the Youth Mental Health Network Health Awareness and Training Administration projects. She also served as a member of the Task Force on Involuntary Examination of Minors, the Governor's Roundtable on School Safety, the Children's Mental Health System of Care State Advisory Team, the state multi-agency, the Florida Youth Justice Commission. She has over 20 years of combined experience working in the education and public health arena. Her previous positions before joining us included the director of the Family Resource Center, pre-kindergarten coordinator of behavioral health training and intervention, psychological examiner at the Vanderbilt Child Development Center, and a community mental health center. Nikki's areas of expertise include trauma-informed practices, compassion fatigue, crisis intervention, behavioral threat assessment, emotional and behavioral disabilities, including dyslexia, and evidence-based practices, early intervention, positive behavioral support, social justice, disproportionate discipline, and children's behavioral system of care. Nikki, you're more than qualified to run today's colloquium, so I turn it over to you. And thank you all again so much for being here.
Nikki, you're muted.
Thank you. Sorry about that. There goes our first technical glitch. So hopefully this is out of the way. Thank you, Dean Surovich, and thank you everyone for joining us today as we address the very timely and important topic of threat assessment, school safety, trauma, prevention, and intervention for our community, our state, and our country. The very important topic of school-based mental health services and supports. Research has shown that when we address children's mental health and wellness early in schools at all levels, it increases positive outcomes for all of our children. The positive outcomes include increased school engagement in school and community, increased academic performance and social functioning, resiliency, and increased high school graduation rates. Youth with access to school-based mental health supports are more likely to graduate career and college ready with the tools that they need to overcome the many challenges they may face in adulthood. We know that the schoolhouse provides many supports for children and families. The COVID-19 epidemic has only served to amplify the tremendous need for services and supports for our children and our families, and especially the need for school-based mental health services. We would like to thank our governor and especially our First Lady and the Florida Children's Cabinet for their focus on this very important and timely topic, children's mental health and wellness, and for the Hope for Healing initiative. Today, we will explore mental health prevention and intervention services in all these areas. With that, I would like to discuss our agenda for today, which includes 3 national experts on school mental health. Each speaker will present for 30 minutes, followed by a 10-minute question and answer period. At the conclusion, we will have our panel join us for a discussion and question and answer session. We will begin with Dr. Mark Weiss, followed by Dr. Melissa Reeves, and end with our very own USF and Florida school mental health expert, Dr. Don Kincaid. We will conclude the colloquium with a panel discussion and question session. We encourage you, though we've muted you, so we can't actually have that discussion in the form we would like, but we encourage you to ask your questions via the chat box. And we will then share your questions with the presenters during the question and answer period. So with that, I would like to introduce our first speaker. Dr. Mike Weiss received his PhD in clinical psychology from Virginia Tech in 1991 and is currently a professor in the Department of Psychology at the University of South Carolina. He was on the faculty of the University of Maryland School of Medicine for 19 years, where he helped found and direct the Center for School Mental Health, one of 2 national centers providing leadership to the advancement of school mental health policies and programs in the United States. He has led a number of federally funded research grants, has advised national research and policy-oriented committees, has testified before Congress, and presented to the President's New Freedom Commission on Mental Health. He helped to found the School Mental Health Initiative International Leadership Exchange. Dr. Weiss has edited 10 books and has published and presented widely in the school mental health field and in the area of positive behavior supports, trauma, violence, youth, and evidence-based practice, and cognitive behavior therapy. Welcome, Dr. Weiss.
Thank you very much, Nikki and USF leaders. It's my pleasure to be with you. I have tremendous respect for USF, the work that you're doing in Florida, the work that you're doing around the nation, just so impressive. And you may see the piano in the back and wonder if I'm going to play. I don't play the piano, but if we have time, my wife and daughter do, and we'll bring them in later for a little recital. Just kidding. You can go to the next one, please. So the terms school mental health and school behavioral health are used sort of interchangeably. I prefer the term school behavioral health to convey that we have a mental health education system partnership where we have the mental health system actually joining the education system, working within the multi-tiered system of support. Again, tier 1 is promotion prevention, tier 2 early intervention, tier 3 more intensive intervention. And through that partnership, we're really improving the depth and quality of programs and services toward improved social, emotional, behavioral, academic functioning in students. This is sort of what I'm going to cover, the school mental health field. Nikki mentioned that with colleagues, I helped to start a national center for school mental health. We'll talk a little bit about that. Positive behavioral interventions and supports. We know Don is quite an expert in that area. We've been working for about a decade to put those 2 fields together and have something called an interconnected systems framework for school mental health and PBIS. I'll cover some key themes talk a little bit about the COVID-19 interface, the context that we're currently living in, and then some of our work in South Carolina. Next. Early on, in 1991, when many of you were not born or in elementary school, I began working at University of Maryland, working in schools. I had no background in schools. I had done my internship at Duke Medical Center and was focusing on pediatric psychology. Spent 4 days a week in a high school in Baltimore and 1 day a week in a mental health center, and just noticed the dramatic difference between the work in the mental health center and the work in the school. In the school, we were just overrun with tremendous need. And in the mental health center, we often didn't see folks, they just didn't come in. We came up with this term called expanded school mental health to convey that the mental health system was joining the education system to augment the work of the school employees to, again, move toward greater depth and quality in services. Not outside professionals, language is really important, but collaborating community mental health professionals, joining the team and building on the tremendous work of the school employed staff. Next. We know that schools are resourced with tremendously talented people, including school counselors, psychologists, and social workers, nurses who have mental health specialty, behavioral specialists, others. However, sometimes position constraints really get in the way. So, for example, we find some school employed mental health staff tied up with scheduling, attendance monitoring, working in the lunchroom, etc. For example, school counseling. Many school counselors are well equipped to provide a full array of prevention and intervention, yet primarily do academic advising. School psychology, same thing, well equipped to do a range of prevention, intervention activities, but often get tied down into evaluation. We want to capitalize on the strengths of these folks and move them out of positions that really constrain their roles and help maximize their functioning. Next. So as the clinicians from the community come in and join the work, clinical social workers, psychologists, counselors, etc., we see a lot of advantages, and that was mentioned in the introduction. Tremendously improved access, improved early identification and intervention, especially for students with internalizing issues like depression, anxiety, trauma related. These are students that are usually falling under the radar and not receiving services. We do a much better job in the expanded school mental health model in reaching these students. We're also able to reduce barriers to learning. We're focusing on this work in education, so it has to be educationally relevant outcomes. But and we see academic improvement, but the caveat is when done well. And what we really want to avoid is a co-located arrangement where we have clinicians from the mental health system coming into the building, let's say Tuesday and Friday, but the school staff have no idea what they're doing. Next. And in addition, these programs often lack an implementation structure. So I remember when I was a program director in Baltimore working in this area, knocking on the doors of schools, asking them, please, can we come in and work with you, given permission, but then with no support, just not knowing how to connect to the students, in really, really poor offices, very isolated, co-located, not in any way connected to the multi-tiered system of support, and really operating without an implementation structure. Next. We were thrilled in 1995 as still a young assistant professor to apply for and receive a grant for a National Center for School Mental Health. This center is still going strong now, now led by Nancy Lever and Sharon Hoover. You can see the website there. Yesterday was its 25th anniversary. Interestingly, when we received the grant for the center, 5 states also received funding for infrastructure support for school mental health, including South Carolina, which is part of the reason why I ended up coming to South Carolina. You can go to the next. On the day we received notification the grant was going to be awarded to us, my son was born, Nate. So he's now 25 also. This was him a little while ago in Sweden at the Misbehaven bar. He's a good kid. Next. About 12 years ago, folks from this PBIS world began to reach out to me and say, Mark, we should work together. My experience was I knew about PBIS, but it really seemed like a separate initiative. And there were PBIS people in the buildings that we were working, but we really did no work together. So really parallel play that was happening from my observation. Lucille Eber and Susan Barrett, two national leaders, reached out to me, convinced me we should work together, and we began to work together. And now I've become a real fan and proponent of PBIS. You can see some of the advantages listed here. This is the evidence-based practice that has scaled up very impressively, perhaps more so than any other evidence-based practice in the world. You can see we're now in around 27,000 schools, and I'm privileged to be one of the partners on the PBIS Center now. Next. See the many advantages for PBIS in promoting effective decision-making, reducing punitive approaches, which is so important because we know discipline for students can have a toxic impact, improving behavior and academic performance. But again, the caveat being when done well. If you can go to the next. Two major limitations for PBIS, again, in the multi-tiered framework. Tier 1, promotion prevention, Tier 2, early intervention, Tier 3, more intensive intervention. Many PBIS schools are doing well at Tier 1, but not so well at Tier 2 or Tier 3. And another limitation is that things often get viewed through the lens of behavior, which results in students with those internalizing issues not receiving the attention that they need. A few years ago, we did a study. We have a group called the Carolina Network for School Mental Health, the two Carolinas collaborating, North and South Carolina. In this study, we documented schools implementing PBIS with fidelity in the two states, and then schools that had clinicians from the mental health system operating in them. And then within some of those schools where we had both strong PBIS and clinicians from the mental health system, we looked to see what was actually happening in terms of collaboration, and we're pretty stunned to find almost no collaboration happening whatsoever. Next. We also really believe in a holistic model. So some of you may recognize the Queen of Sheba here, who's actually in the Bible. So we want to improve social, health, emotional, behavioral, and academic functioning in students. For example, on the health side, which is often neglected, we know that students' sleep and nutrition and exercise is really, really important to how they're functioning. I'm actually now working with some folks from exercise science at USC who really also emphasize the importance of motor development. So they said this should actually be SHEBAM. And another colleague says, wait, you forgot spiritual, so it should be SHEBAMs. So, but we're going with Sheba for now. Next. Related to our work with the National Center, was just really thrilled to in 2011 begin to have meetings with the National Center for PBIS, the National Center for School Mental Health, working together. Let's develop a framework where a common space for our work. We developed this interconnected systems framework for school mental health and PBIS. This was an ebook that was published in 2013 by the PBIS National Center. You could still find it on www.pbis.org, search term school mental health. This has been downloaded more than 50,000 or viewed more than 50,000 times and provides really pragmatic guidance for how the mental health system can join with schools in relation to effective teams, decision making, implementing evidence-based practices, refining them from a vantage point of schools, districts, states, and federal national resources. Next. Interestingly, importantly, they're related to all of that interest. For the past couple years, we've worked on the next issue of this ebook. So volume 2 is now out. It came out in 2019 and was recently published by the PBIS Center. So you could also find this on the pbis.org website. This ebook focuses much more on implementation issues with a range of pragmatic tools and resources for doing the work. Next. If you could go to the end of this one. One more. So really, this is about a team that includes the mental health clinician fully on the MTSS team, with that team empowered, including people of authority, meeting at least twice per month, having critical conversations about work in each of the tiers, working to make sure we're implementing actual evidence-based practices, implementing systems based on database decision making, and ideally having connections that go horizontally in school buildings that we're really building interdisciplinary collaboration, including with families and students, and I'll come back to that, but then also really building the vertical collaboration so that we have strong connections at the building to district to state levels and really strong collaboration happening both vertically and horizontally. Next. This is sort of a conceptual framework. At the bottom, we build with this meta construct of a shared agenda. That is that this work is relevant really to every group in society, right? Because this is about children, helping them learn, helping reduce and remove barriers to their learning, helping them matriculate, helping them graduate, helping them go on to become productive members in society. So we build from a shared agenda. I'm going to elaborate on that in a minute. We really have strong district and building leadership. The memorandum of agreement for how the mental health system and the education system work together are really critical. We're improving data use, team functioning. We're moving toward greater depth and quality in services, which in turn is leading to improved outcomes for students. Next. And really, 3 connected priorities. By doing that, we're implementing effective practices. We're then documenting valued outcomes, and we're using those findings to build capacity. And I know Florida is a state that has really built tremendous capacity in the state related to the positive outcome findings that we know for school behavioral health when it's done well. Next. The district community leadership team is absolutely essential, and there's a lot of information about the DCLT in the new ebook on the ISF. So what we want to see with this are all the various youth serving systems working together, including education, mental health, child welfare, justice, primary health care, disabilities, other community stakeholders, including the faith and business communities, most importantly, having families and youth guiding the work, doing resource mapping, determining within districts where we have strength, where we have needs, progressively building this agenda and expanding the number of schools that are implementing the ISF model. Next. And as mentioned, these are all the various stakeholders, and there are probably other groups. Again, this is an agenda that should involve all the stakeholders. We really believe in a community of practice model where the systematic work, let's say, advancing effective school behavioral health, advancing the ISF framework in Tampa schools, that systematic agenda lays on top of the relational agenda. We have to pay attention to the relationships, or the systematic agenda is not going to work. Next. The DCLT, so I'm not going to get into all the details on this slide, and I believe folks will have access to these slides, but it's really in a mediating kind of role where interacting a lot with the school buildings, understanding what's happening in each of the buildings, but then interacting with what's happening above. What are the state level initiatives? What are the policy initiatives? What are the resources? What's going on in adjacent states? What's going on through national centers? How do we have the great work that's happening at the state level and in other states and through national centers, through federal initiatives, reach down and influence the school buildings, and in turn tracking progress in the school buildings to get to identify best practices and get them up and out. Next. Alignment is really important. You can keep clicking on this one, please. We steal each other's slides in the PBIS and School Mental Health world. So this is one from Kent McIntosh with a really cool picture there, which I believe is actually true, Kent said, one of the major variables affecting sustained implementation of effective practices is the introduction of new initiatives that either compete with resources needed for sustained implementation or in fact contradict them. And we've actually seen that. For example, the shiny new social emotional learning program comes into a building or district, and they say, oh no, we don't no longer need PBIS, which is absolutely untrue and absolutely a very bad direction to go in. Next. This is a little bit old, 2013. There used to be something called the National Registry for Effective Programs and Practices managed by SAMHSA, which was a clearinghouse, kind of like the What Works clearinghouse on validated, vetted, evidence-based practices. Back in around 2010-11, there were more than 300 quote-unquote evidence-based practices that came up if you put in search terms such as mental health in schools. And we did an analysis looking at those programs to determine for where we could find data, could we categorize the programs as for-profit, non-profit, public domain, or not determined. And what you can see from here is there are a lot of for-profit programs that are expensive to implement initially and expensive to sustain. And this is a huge agenda in relation to alignment. There are a lot of companies selling things to schools. Many of those products are not evidence-based, but a principal, a district superintendent pays $600,000 for a program. It's clear it's not working, but because we paid $600,000, we got to keep implementing it. There's that cognitive dissonance. So this is a big thing, and in my world, with our team and our collaborators, all of our work is in the public domain. Everything that we create goes into the public domain, and we wherever possible, use public domain assessments and interventions. Next. Screening is a really critical agenda. Joni Splett is a close collaborator and friend of mine in your state at the University of Florida. Joni and I and others are part of a very large randomized control trial funded by the National Institute of Justice that has tested the impact of the Interconnected Systems Framework as compared to PBIS and throwing clinicians in the building and the ISF, with some very positive outcome findings from that study that I'm not going to get into here. But we've also done a range of descriptive analyses, and this slide just shows that typically when you don't do a systematic screener, about 10% of students may get identified as having needs, primarily through observation, getting in trouble, missing school, etc. Those are the students that get identified. When you add a screener, you find an additional 18% of students. And about half of those students that you find through the screener have more significant problems. Many of them with the internalizing issues that I mentioned are often falling through the cracks. This is a big public health issue. We have to screen. People are avoiding it. They're saying we can't screen because if we screen, we don't have the resources to meet the need. But we need to screen to identify how urgent this agenda is and to help identify these students early on so that we can provide support to them. Next. The PBIS Center also supported our work in this area of family and youth engagement and leadership, and we started meeting in 2015. Don was one of the leaders of this work with me and Kathleen Lane and Andy Garbatz. In 2017, we published this ebook, which is basically, we totally have to change the paradigm around family and youth engagement in schools. They're not engaged, they need to be engaged. If they're engaged, there's going to be a much better response. There's going to be better outcomes across the board. And we have to totally change the paradigm. Next. This is Hart's Ladder that's been around since the 90s. It, is a good summary of kind of where things stand with this. At level 1, students are just manipulated. The contingencies in the buildings are about the adults, they're not about the students. At level 8, students and families are co-creating the educational environment. Most schools, if they were to honestly reflect where they stand on this, they'd be maybe at a 3 or a 4. So there's very, very significant work for us to do. Next. We didn't want to just put out an ebook and leave it at that, so we developed the Family School Community Alliance, which is supported by the PBIS Center, but also its own independent organization, co-led by Andy Garbatz of University of Wisconsin and Devin Minch, who was at USF, now at University of North Carolina, who've done just tremendous work with this. Next, you can see the mission. One of the things that we've worked on, and Ken McIntosh has been an advisor with us on this, is building on the tiered fidelity inventory to develop items that reflect, is your school actually collaborating with families and youth? So you can see this TFI FSC next. I'm not going to get into the details, but you can see, you can look at this later and see the various domains and how we've added some items to promote family and youth engagement and leadership in all aspects of schools' multi-tiered systems of support. Next. Continued, you can see the other items. We've been fortunate to have a fairly recent grant about a year ago from the National Institute of Minority Health and Disparities, and we know that inequity is a big issue. It's a real thing, that youth of color are disciplined more, youth of color are more likely to enter the justice system. We know that the school to prison pipeline is a real thing. Colleen Halliday from the Medical University of South Carolina is leading this grant, and Joni Splett and I are co-investigators, and you can see some of the other folks. Kelly Perales, one of our lead coaches, Kent McIntosh, a lead consultant. Next. You can see some of these elements to reduce the inequities, database decision making. Kent has some really amazing resources there. Teacher wellness and stress. We know that decision making is compromised when staff don't feel well or they feel stressed out. Addressing unintentional bias for teachers and students, and identifying vulnerable decision-making points and creating neutralizing routines. And again, a lot of this is from the work of Kent. Here are some of the key wellness strategies for staff. They're really critical in this current context. Reducing stress, reframing it, I can cope with this, and then getting social support. And there's actually a recent study that came out that if you connect those two things together, it actually creates resilience and boosts your immunity and helps to promote health. That is, reframe stress, I can handle this, and then go talk to a friend about what you experienced, or your family or your wife or whomever. We know that social media, and this has come out in some of our own qualitative research, is exacerbating stress. Many of the students, my youngest is 18, and I talked to her a few months ago about why is suicide increasing for young people, and the first thing she said was social media, Dad. There's so many dimensions of that. Sleep is so absolutely critical. Mindfulness. One of my COVID-19 coping strategies is Zen involvement in nature, taking my dogs on regular walks, exercise, nutrition, cognitive coping, replacing negative thoughts, problem solving, etc. This is very impressive, and is something that would reflect sort of neutralizing routine, so that imagine you're a teacher and there's a few students in your classroom that you feel like the relationship isn't right with them, and maybe they're stressing you out, and maybe they're coming from really problematic environments, really challenged environments. This is very compelling, so I'm going to read it. "'Cause I Ain't Got a Pencil" by Joshua T. Dickerson. I woke myself up because we ain't got an alarm clock. Dug in the dirty clothes basket because ain't nobody washed my uniform. Brushed my hair and teeth in the dark because the lights ain't on. Even got my baby sister ready because my mama wasn't home. Got us both to school on time to eat us a good breakfast. Then when I got to class, the teacher fussed because I ain't got a pencil. So that's just a great metaphor for how we really need to enhance our empathy for these students, and pause and reflect, and not jump to, for example, a discipline event. Back to the community of practice notion, we built the Southeastern School Behavioral Health Community to promote sharing within and across states in the Southeastern region on school behavioral health. We have an annual conference. Florida has been a really strong participant. Next. We have significant funding, and thanks to our State Department of Education for the Behavioral Alliance of South Carolina, we have a multi-realm strategy. Next. Realm 1 is the annual conference. Of course, this past spring we weren't able to do it. This year we're going to have hybrid, we hope, fingers crossed, virtual and in person, with the in-person component being live streamed, and you can see the dates. We would hope to have a Florida contingent there. Realm 2, we're doing all kinds of things in terms of online resources, webinars, chats, conversations, connecting to other groups that are doing these things. Next. You can see some of the enhancements. We basking in the spotlight, where we put all kind of different staff in the spotlight to have sort of a casual conversation about their observations in that one. Travis Hughes, a lead bus driver in one of our districts, Caregiver Corner, and other resources. Schoolbehavioralhealth.org/BASK. If you have interest in any of these resources, you're welcome to join these virtual events. Next. You can see our website, and we're really working social media. We've got all these young people. So we're working Twitter, Instagram, Facebook, even TikTok, and really beginning to have a much greater presence with the strategic social media outreach. Next. Just more of our resources. We do sort of a monthly what's upcoming. Next. And then in realm 3, we're working on a high leverage practices manual, building from the ebook, the 2 ebooks for the ISF, and working closely with the Midwest PBIS network, Kelly Perales, Lucille Eber, and colleagues, as well as the Mid-Atlantic network, Kim Yannick, Susan Barrett, and other, Patty Hirschfeld and other colleagues. And we're working intensively in 4 districts to try to really operationalize all of these themes that I've been talking about today. Next. I was fortunate about 2 weeks ago to attend a colloquium at USC by a local pediatrician, Deborah Greenhouse, who talked about the child and adolescent mental health and COVID-19 interface. There's actually not a whole lot of hard literature on this, but we're confident that mental health challenges have increased for everyone. We should just all acknowledge that. All of us are struggling, and some are struggling more. We have these other themes of widespread uncertainty, fear, pandemic fatigue. I was one of the naive ones that thought this was going to be over in late April. We see particular increases in anxiety, depression, obsessive compulsive disorder, and eating disorders. We see some students binging and purging and not eating. We see other students sitting in front of a screen and eating all day. And Dr. Greenhouse mentioned she's seen students on her caseload who've gained 20 pounds in a month. We see increases in mental health challenges paired with impeded access. We do have telehealth, but telehealth is working for some and not working for others. It's especially not working when you have a scenario with a younger child with externalizing, acting out behaviors, with parents at home who are working, and we hear stories like the child gets put in front of the screen, mom walks away, and then the child walks away, and the clinician's just sitting there like, what do I do now? Next. Obviously, there's been very significant socioeconomic impacts. This varies around the nation. Disparities based on local district. There's probably at least 20 different arrangements in South Carolina. Some of our districts are 5 days full with a virtual option. And there's a call among many families that that's what they want. We're in Lexridge 5 here. That's what the families are telling the school district they want. We want full 5-day access with a virtual option. Virtual not working for many, working for some. We're obviously also, a lot of this isn't news to any of you. We're seeing decreases in other medical care and immunizations, and gaps in other resources such as school supply drives that would have happened that didn't happen. So students don't have access to the supplies that they would have had. There are some positives. Obviously, for some families, we're seeing increased family closeness. I believe we're seeing improved collaboration within and across agencies. We're breaking down some of the barriers for telehealth, so there's some good things that are happening. You can go to the last one. Yeah, go Gamecocks. We do have football back, and that's a positive thing that's helping my own mental health. So I'll stop there. Thank you all very much for your time.
Thank you, Mark. If participants would like to ask Mark a question, we encourage you to use the chat box. Mark, we have a question about the ebooks that you mentioned. Are those available through the PBIS website?
Yes, they are. If you go on pbis.org and put in the search term school mental health, both of them should come up. Also, a range of relevant resources are housed on the Midwest PBIS network website. You can find them there as well.
Thank you. I have another question for you. What do you believe are the 3 basic building blocks that are needed to help schools and communities build a community school partnership in providing children's mental health services and supports?
That sounds like a doctoral question for dissertation examination, but I'll give it a shot. I think, obviously the real emphasis on collaboration at multiple levels. So interdisciplinary collaboration, including the youth and families, cross-system collaboration, including between education and mental health, really emphasizing that, emphasizing relationships, taking time to build relationships. In the SHIBA paradigm that I presented, social health, emotional, behavioral, academic, the reality is we need to be focusing more right now on social health, emotional, behavioral. I would say that that's essential. I think also really having great respect for folks who are working in schools, who are frontline workers in the trenches, and really supporting their health and wellness, as well as having tolerance. I think it's an ongoing discussion for us at our university that we have lowered expectations right now. We need to just be more tolerant and lower our expectations. So those are some things that I just made up to a very challenging question. I hope those were helpful.
Thank you. Yes. We have another question from our participant, Donna San Salvador. Do you think the president's contraction of corona will affect the in-school yearly plans?
I think that question's above my pay grade, honestly. I don't know. Obviously it's concerning, but I do know that when you talk to the stakeholders here, folks really need for school to be open. So I hope that it doesn't disrupt schools opening, in my own personal, not professional opinion.
Thank you. I did also want to ask you, you talked about telehealth, and that seems to have been a bridge for us in providing mental health services, not only during COVID, but in times of not having maybe mental health services and supports in rural areas, or in areas that don't have those supports, a way of bringing in supports to people who need them. What is your what would be your recommendation regarding providing telehealth services in those situations?
I think it's one of the silver linings. I've been connected to telehealth for 2 decades and did a lot with that at University of Maryland, and there were always tremendous barriers in terms of HIPAA compliance and equipment and things like that. A lot of those barriers have been broken down. Also barriers related to working across state lines and things like that. So related to the urgency of the situation, we've seen a tremendous boost in telehealth, and that's a really good thing. We've also learned that a lot of our work can be done virtually, and that's a good thing as well. For example, our implementation support now in research studies has pivoted to virtual, and we think we might just keep it virtual even when we can be in person. So those are silver linings. For me, I think it's working. Obviously, we need to build the research agenda, but it's matching types of people and types of problems that do better with telehealth, and really emphasizing telehealth for that, and retaining the in-person option wherever possible, obviously with appropriate social distancing for other issues. As an example, I presented the younger child with disruptive behavioral disorders. That's probably not a great match for telehealth. However, the adolescent or young adult or adult with depression, anxiety, social anxiety, in particular, through some of my international conversations, we're hearing about a real boost in utilization of mental health services for those folks, because those are the type of folks that may be anxious about going to a mental health center. So for them, telehealth has really been a great match to their needs. So I think the research and policy to better match types of people and types of problems with telehealth versus other options is really an important direction for us to go.
Thank you. Another question that we'd like for you to respond to is, what in this time of COVID-19 pandemic and social justice or injustice, what are some of the specific interventions that school districts and school-based mental health providers may want to be able to provide for all of not only children, but actually for school districts and teachers and staff.
Yes, certainly I'm a clinical psychologist, so I'll come at it from the mental health side. I think our Project RISE that I presented to you around reducing inequities in school discipline is absolutely essential and fits well with the current challenging context in the nation around racial injustice. We have another project funded by the Patient-Centered Outcomes Research Institute, PCORI, that was based on qualitative research, a prior qualitative research, and the qualitative research underscored two primary themes. One, families are tired of being marginalized. They want to be equal collaborators. We need improved communication and collaboration with mental health and education in a triangular relationship. So we have partnership teams in buildings that involve family members, working with teachers, working with clinicians, working with school staff to improve the school environment. And a big part of that work is mental health literacy. Mental health literacy is something that's more prominent in other nations. We know that mental health education in and of itself is an evidence-based practice, that when people, for example, that have mental health challenges learn about mental health and challenges, especially the particular challenge that they're contending with and strategies to better manage it, that in itself promotes improvement. And mental health literacy also reduces stigma, and we know that stigma is the #1 barrier for people to receive mental health services. And we know that there's a dramatically elevated need for everyone right now for mental health services, so we need to be focusing on broader approaches to tell people about mental health, but also to reduce stigma and increase help seeking.
Thank you. Absolutely, reduction in stigma is our #1 barrier in our youth and our families accessing services and supports.
Yes, we find that everywhere.
Okay, so I am looking at our question and answers, and I don't see one. Let me see. I think there's a message coming here for me. Okay, there's another question. I think I have a delay in receiving it. Okay, so thank you. I'd like to know, where is a great place to start when attempting to make connections between PBIS and SMH? Our district leaders are inquiring now. I'd love to bring them something that could give us a good start. Great question, Suzanne.
I think the problem often that I observe is you've got multiple groups operating in a community and no one is stepping forward to be the convener. So we're all operating in parallel play. All the youth serving systems and families and youth are key players in this agenda, but education and mental health are probably the two most prominent players. I would say either the district or mental health center, and your state doesn't have a highly organized community mental health system, so it may be better for the districts to take the initiative to convene a meeting with your local mental health center collaborators, with your families, with your advocacy organizations, the Federation of Families for Children's Mental Health, the National Alliance on Mental Illness, groups like that, with your universities, because there's a tremendous in-kind contribution of the universities, with your justice and child welfare leaders, with your primary care leaders and others, with your faith and business leaders. Take a step forward, organize a meeting, organize some data on what's going on within your district. And I know you have some very large districts there. Do a preliminary analysis on what are the strengths and what are the gaps, what are the needs, and begin to involve that group in the ongoing problem solving so that it ultimately turns into your district community leadership team. Identify the resources, the gaps in resources, the opportunities, develop a meeting schedule, take good notes, metacognition, think about your thinking and just get on the pathway that way. would be what I would recommend.
Thank you, Mark. We have another question. Are we focusing on children with IEPs only, or are we providing trauma-based services for children who have been abused?
No, this work should be about all the children. It should be about all the children. Obviously, the students at risk for or in special education have elevated needs, and they actually may be in double jeopardy because they may, for example, be in special ed related to depression, and their IEP says once per month counseling, which is 10 or 15 minutes. And then the other systems say, don't worry about that child, they're in special ed. So they're in double jeopardy. All of the students are in need of these programs. And obviously the base rate of issues now is higher. So, it used to be about 1 in 5 students was presenting, significant emotional behavioral challenges. It's probably higher than that now. Again, the data aren't in, but it's probably 1 in 3 or higher. So this is an agenda relevant for all the youth, and we should also be evaluating the quality of our processes, both for students in general ed and special ed.
Thank you. That was a great question, and thank you, Mark, for addressing the need for all children and youth to have supports, mental health services and supports. We have another question from Qasim. Listening to you speak about collaboration, do you have any tactics that can aid in the conversation with the stakeholders that would help for many of us to plant the seeds in the mind of those in charge of dispersing the necessary information among a district and then a school campus? Communication is vital, but is there a special way to approach this?
Sure. I would. I have a close colleague friend named Joanne Cashman who really turned me on to the community of practice concept and the National Association of State Directors of Special Education. And there's a document called Leading by Convening that's really valuable. That if you Google that, but it's about getting a group together, as I mentioned before, a diverse group, and giving them, rather than just bringing them in, giving them in advance information to think about, to read, to reflect on, and don't jump in right to your agenda, but rather start with an interactive forum to really get people engaged with critical topics that we're facing, with the goal to move the discussion along from just discussion to dialogue, to collaboration, to really meaningful collaboration and policy change and resource enhancement.
Mark, thanks for mentioning Leading by Convening. That is an initiative that the Florida Department of Education has trained many of us within our exceptional education services and our discretionary projects in, and definitely a great way for having those conversations and leading to real positive outcomes.
Thank you.
We have another question. I'd like to know, where is a great place to start when attempting to make the connections between PBIS and SMH? Our district leaders are inquiring now, and oh, well, it looks like we've already had this question. Sorry. I think you've already answered that one previously. So it looks like it just got redistributed. Sorry about that.
No problem.
Mark, any closing thoughts you'd like to share with us? Thank you so much for all the resources and the information and addressing all of our questions and answers. Are there any final thoughts that you can help us so that we can help the children and families of Florida?
Well, I think that you have tremendous momentum there. You have a lot of resources in your state reflected by what's happening there at USF, University of Florida, other locations. I know that from the horrible tragedy that happened in Parkland that you have a range of financial resources there. I know that you have a priority on school mental health. So you have considerable forward momentum. I would say continue to do things like this, continue the dialogue, continue your forward momentum, reach out to other states, interact with other states in our Southeast region. Come to our conference in Myrtle Beach if we have it. That would be great. Just keep up doing the great work that you're doing. Thank you.
Thank you, Mark. And I have been to your conference and it is wonderful. So thank you for always sharing evidence-based practices and the latest in school-based mental health. Thank you.
Thank you, Nikki. Thank you, everyone.
So now I actually am very honored to be able to introduce Dr. Melissa Reeves. She is a nationally certified school psychologist, a licensed special education teacher, a licensed professional counselor, and a former district coordinator of social, emotional, and behavioral services. She formerly worked for the Cherry Creek School District in Colorado and was an adjunct instructor for Winthrop before accepting a full-time position as associate professor. She teaches both undergraduate and graduate psychology courses for Winthrop, in addition to supervising graduate school psychology students in their field-based traineeship and internship placements. Dr. Reeves is a co-author of the National Association of School Psychologists Prepare School Crisis Prevention and Intervention Curriculum, the first nationally disseminated school crisis prevention and intervention curriculum, and one that many of us in Florida school districts are trained with and have utilized. And actually, Dr. Reeves is the person who trained me to be a trainer. And I am so excited she is here. She's also a founding member of the Colorado Society of School Psychologists statewide crisis response team, which trains school districts across Colorado in crisis response. In addition to responding to various local crises over the years, she travels both nationally and internationally, training professionals in the area of crisis prevention and intervention, threat and suicide assessment, the impact of trauma and PTSD on academic achievement, and cognitive behavior therapy in the school setting. She has conducted more than 200 workshops and presentations and works with schools on establishing a positive and safe school climate that focuses on prevention programs and positive discipline measures to decrease behavioral incidences while increasing academic achievement. She has also provided consultation and staff development training to the Department of Defense educational activity schools located on military installations. Welcome, Dr. Reeves. We are so excited to have you join us today.
Thank you. I'm excited to be here. So we have a lot that we are going to cover in a very short amount of time. So, because we're going to be talking about stress and trauma, and what are some of the similarities, but also some of the key differences. And then we're going to cover a little bit about the social emotional learning and then on threat assessment. So what you are going to see is actually a lot of this is going to piggyback off what Dr. Weiss just mentioned, because where he was presenting kind of the bigger picture and the collaborative piece, what I'm going to try to tie together is some of the nuts and bolts that we can actually do to operationalize this within schools. Okay, so go ahead. Currently what we're seeing, and this is really no surprise to many of us, is the impact that the recent stressors have had on all of us is pretty significant. So, you know, a third of Americans are now showing some clinical signs of mental health challenges. We've seen a huge increase in those that are making calls to, you know, distress hotlines. 50% of employees, you know, only 50% of them are comfortable discussing mental health, and that also includes educators. The concern with that is that if we don't decrease that stigma around mental health, and if the adults are not staying mentally healthy, it does have impact on those kids that we're working with within schools. There's also some projections that just given the complications and the amount of significant stressors that many of us are under, including the financial stress that this has had for our country, is that actually some of these long-term consequences may last upwards of a decade. Therefore, the attention that we need to place on mental health, particularly in schools, is going to be so critical to mitigate the negative impact as much as we possibly can. So we do have mentally healthy young individuals as they move into adulthood. And then also what we're seeing too is that, the pandemic stress we're seeing is significantly higher in youth. Some of that is because, for example, some of our adolescents and, college age have lost jobs needed to either help pay for higher ed, or many of them were working to help their families, in addition to just the impact that it's had in the disruption academically. But also even more significantly, it's been the loss of the social connections and a lot of the social supports that many of us rely on to make it through some of the challenging times. So when we take a look at, a recent study that was done with teachers, they asked them how they were feeling. And many of them reported, that they were feeling anxious and fearful and worried, overwhelmed and sad. And so there's kind of like this challenge here of, you're sending messages that as educators, we need to take care of ourselves, but yet we have to learn this whole new skill set. And now we have to figure out how to do things virtually. And now some of us are back in the classroom with half of our students, where half of the other half are, Zooming in or, whatever virtual platform they're using. And then I have my own kids at home while I'm trying to teach other kids. And how do you expect me to do it all? So you're saying take care of myself, yet how do we do that? And I'm going to have some potential solutions for that. And when they asked them how they wanted to feel, they really talked about being happy, inspired, valued, supported, effective, and respected. So those are things that we can get to through a lot of the initiatives that Dr. Reese was talking about, but also by implementing some social emotional learning strategies. Now, when we talk about what they need, a lot of our staff are saying we need greater emotional balance. We need time to adjust to what this new normal is. And I agree with what Dr. Wee said. I don't think any of us had any idea that this was going to go on for months. And they just want to have honesty, respect, kindness, flexibility, and most of all, patience from school administrators, and more realistic expectations that they're not going to be able to do everything that they were doing before. So how can we really focus in on those critical aspects that we need to do? And how do we help our, individuals that are working in schools, whether it be teachers or our other support staff, set boundaries so they're not working around the clock? And for example, I have a close friend of ours who's a middle school teacher, and we were all together on a Friday night, and she kept checking her phone. And I'm like, what are you doing? Like, put that down. And she goes, I just got 20 emails from parents in the last hour and a half. And this was a Friday night. And she's like, and I'm expected to respond to all of these. And you could just sense the overwhelmingness that she was feeling about balancing kind of this new normal. And what they're really asking for too is, what are some strategies out there that, that we can have that not only help support their own wellness and resiliency, but also help support that within the students that they're working with? And so when we look at how is this crisis different for schools, and notice I crossed out the word crisis and made it plural, is because we're dealing with multiple crises at one time. For now, especially with COVID, we don't have a clear end. The guidelines keep changing. So we do this and the next week there's something else. The complexities of everything we're dealing with, not only with physical health, but now, psychological well-being, and then trying to balance academics. The magnitude of the impact has been tremendous. And it really has been trauma on top of trauma for many of our families that already had a history of adverse childhood experiences. And then what we also know is that it's exacerbating already existing inequities and social injustices. Then on top of that, we have many of the regions in our country where we're dealing with wildfires, we're dealing with hurricanes. My hometown in Iowa, had derecho, which was kind of a combination of a hurricane tornado coming in at the same time. And so on top of that, they're dealing with all these other more localized variables. So so again, the stressors that everyone is under is pretty significant. But one of the things, I'm going to talk about in a little bit is a little bit of how we can reframe some of this is someone introduced me to a webinar that they had watched. And two of the psychologists were talking about, instead of seeing this as a problem, we need to see everything we're dealing with right now as a dilemma or as a challenge, because sometimes problems seem insurmountable and we don't always know if we can come up with a solution. But if it's seen more as a dilemma or a challenge, we tend to perceive that as something that we just need to continue to work through, and we need to address the challenges as they come, and we can be successful in doing that when we have the right supports in place. So I think it's important, that we reframe a lot of this as we're not necessarily going to have answers to the problems, but we definitely know that there's strategies that we can implement to help manage some of these challenges. So this is one of those pictures I like to show because I think a lot of us are feeling like this right now of, oh my gosh, how am I going to juggle it all? But one of the things that's important for us to understand is that while stress and trauma are related, there are some key differences between the two. So I want to first start off with kind of defining the stress, because there's actually 3 different types of stress. There's actually positive stress, believe it or not. I know some people go, how can stress be positive? But it is actually necessary for normal development. Learning how to deal with stress is actually an important life skill. But where there's positive stress is that it's moderate and short-lived. So these are the things we deal with where you have an impending deadline. Quite honestly, if you didn't feel stressed about it, you probably wouldn't get the project done. You're stressed because you've got a lot of things to accomplish today and to get through that to-do list. That stress motivates us to get through the to-do list. And when we do, we feel accomplished. Okay. Then there's the tolerable stress. Now, what this is where, for the most part, there's short-lived acute stressors, okay? So maybe the loss of a loved one, potentially a natural disaster, or some sort of an injury, okay, or a family crisis. With the right supports, you can work through those stressors, okay, and get back to a sense of, continuing to move forward with your life, and they're more tolerable. But without those support systems, they can be potentially harmful. Then we have the toxic stress, and this is really where exposure to those adverse childhood experiences come in. It's the strong, frequent, prolonged activation of stress responses. And when this happens, that is where we definitely see those long-term negative outcomes, not only for physical health, but also mental health. So when we talk about some of the acute traumas, and these are more along the lines, and you can go ahead, of the time limited or their tolerable stressors. When there is a perceived, threat, you have kind of the adrenaline and the cortisol that is preparing the body to respond. We kind of have the fight or flight, but again, with the right support systems and ability to work through, the body returns to baseline. And for the most part, when the threat discontinues, we're able to relax, and we have some periods where, life functioning is relatively easy, or at least, manageable. When we talk more about the complex trauma, if you want to go ahead and advance here. Yeah, this is where we have individuals exposed to multiple traumatic events, and there is this cumulative effect. So what ends up happening is you have a perceived threat, okay? Then you have the adrenaline and the cortisols preparing the body to respond. There is the fight or flight. But then what happens, go ahead and click again, is that the body doesn't return to baseline. Okay, go ahead and click one more time. There's a little arrow here. Yeah. So what happens is this body just stays kind of on this heightened state of awareness all the time. So we're much more hypervigilant. We're much more sensitive to, to potential triggers. And it's kind of like walking on eggshells every day. So for our students who are going through complex trauma or experiencing a series of toxic stressors, in the classroom, it is hard for them to mentally and physically relax in order to be able to learn. So a teacher approaches them and in a stern voice says, I need you to finish this assignment. They perceive that more as a lion roaring. They don't perceive it as a firm voice. They perceive it more like a lion, and then boom, immediately they respond, either with a physical reaction or with a verbal reaction that oftentimes gets them tossed into the principal's office And then there's some sort of consequence that comes down for noncompliance or defiance. This is where the trauma-sensitive, trauma-informed schools work come in. This is where all of the PBIS comes in, that Dr. Reese was talking about. It's if we can better educate our teachers on how to identify many of these reactions and implement trauma-informed, trauma-sensitive approaches within the classroom, we can help better manage some of the traumatic situations or some of the trauma reactions that we are seeing with some of our students. Go ahead. So when we look at, in regards to some of the reactions that we're seeing, how do we determine if it's more stress or if it's more along the lines of those traumatic responses? When we're seeing extreme physical reactions like chronic fatigue, exhaustion, significant difficulty paying attention, confusion, hypervigilance, headaches, stomach aches. So put your nurses on alert. These are the kids that oftentimes, if we are back in school, they're in the nurse's office a lot, sleeping or eating difficulties. Those more significant reactions, again, are telling us there might be some traumatic impact. Emotional reactions like excessive worry, anxiety, the disconnection or numbing, extreme anger, compassion fatigue, having distressing dreams. Oftentimes, they're very confused, difficulty making decisions, sadness, depression, hopelessness, suicidal thoughts. Those are also indicators that it's not just one of those tolerable stressors or positive stressors. We really are seeing more of a trauma reaction. Social and interpersonal signs, extreme difficulties with getting work done, engaging in work or school, irritability, outburst of anger, social withdrawal, isolation in our older students, and even potentially our staff members. We really need to look for substance abuse or excessive substance use in regards to self-medicating. Again, those can be signs of some traumatic reactions. And then we really need to be monitoring our staff and so forth for that compassion fatigue, because some of those secondary traumatic reactions, which basically we see because of they're expending all of this time caring for others, they don't have good self-care plans. Then we also can see some of these reactions within even our primary caregivers. Now, in regards to COVID-19, a lot of people say we have kids that are traumatized or we have staff that are traumatized. Quite honestly, not all of them are traumatized. Are we all experiencing some stressors? Absolutely. So how do we kind of help make that distinction? So this is based upon the framework within the Prepare curriculum. And again, this is more qualitative in nature. But when we're looking at how significant of an impact has COVID-19 had, we're really looking at a couple different things. We're looking at their pre-COVID experiences. Were they mostly positive? Were they really enjoyed school, okay, and felt very, very connected and supported and felt cared for as part of a community? Was it kind of a variable experience where, they kind of liked school, but there were some aspects of school that weren't really great? They have some friends, but maybe not a lot of friends. They might have been involved in school activities that they enjoyed, but maybe they struggled academically. Or was their pre-COVID experience pretty much negative, where they disliked most aspects of school? They may not have had real social relationships, good social relationships, not a lot of supports in place, and so forth. Then we pair that with also looking at what was the degree of support within while we've been in shelter in place. If you can go ahead and advance, has the degree of support that they've been receiving over these months while we've been sheltered in place healthy, safe, supporting, nurturing, and adaptive, okay? Where for the most part, yes, their family has experienced some stressors, but nothing significant, nothing that they couldn't manage. Has it been variable? Yeah, there's been some challenges, but also there's been more significant stressors like losing employment, separation from family members, maybe the loss of a loved one. Or has their shelter in place experience been incredibly negative? Very unsafe, unhealthy, dangerous, potentially maladaptive, significant stressors like death of a loved one, loss of a home, we've seen significant concerns about child maltreatment because they're no longer at school where there's a safe place, and now they're in environments where there's some pretty negative or potentially abusive interactions going on. are parents starting to substance use and an exacerbation of mental health problems, or potentially even rejection. They don't have a lot of social supports. So when we kind of look at this in a matrix, for those where their school experiences prior to were positive and their shelter in place for the most part has been positive with supports, they're experiencing more of those tolerable stressors, okay? But for those where it's been more variable on both ends, they're more low to moderate. For those where you've had negative on both ends, and for the most part, their shelter in place environment has a lot of those toxic stressors, those are definitely the ones where we need to get in there and we need to provide more directive and intensive mental health supports within schools. So when we look at this kind of from the multi-tiered framework, one of the things that we need to consider is that what used to be tier 2 may now need to actually be tier 1 services. And I'm going to really focus in on the SEL piece of this for the social emotional learning lessons that we can do at that universal level, so we can really address a lot of these challenges, that are going on. Okay. So when we talk about what are some of these strategies to manage emotions, one of the things that we want to do is we want to help reframe. Okay, so for example, and this comes straight out of the book of cognitive behavioral therapy, is, I really hate that we use the term social distancing when we first started all of this. Okay, and this is one of those slides where there's going to be a lot of clicks, FYI. There we go. What we really need to reframe that to is physical or spatial distancing. We don't want people to socially distance, but we do need to physically distance. We can reframe this for our students that shelter in place is not completely miserable. There's actually been others that have done it. So what can we do? Integrate this to academic instruction. How have our astronauts done it? How have those scientists on Antarctica have done it? How have those that are serving our military on submarines? If you think about it, they've been in close quarters for months on end. So we can do some research. What are some things they do to keep themselves mentally and physically healthy? A lot of people now are saying, oh my gosh, I'm so tired of hearing of the term self-care. Now what the newer term is career sustaining behavior. Again, this is working through challenges. What can we do to stay mentally and physically healthy in our jobs so we continue to enjoy what we're doing? Also, a lot of people say students are not learning. They're learning, but they're learning just in different ways. And then some people say, well, we need to decrease expectations. We don't necessarily need to decrease expectations as much as we need to modify expectations. So this really goes back to focusing on what's absolutely critical and doing it well instead of trying to have our teachers focus on too much. So what do we know are some of these protective factors that help with those career sustaining behaviors and help kids continue to achieve academically and socially emotionally? It is when we have well-developed social emotional learning skills. And there's also research showing when the administrative leadership has more developed emotional skills. They understand the importance of PBIS and social emotional learning. Not only is academic achievement higher, but staff members are much more satisfied working in those particular environments. So what we know is that emotions matter for almost everything needed to be successful in life. And what we really want to teach individuals is that really all emotions are okay. It's what you do with those emotions that can make a difference. So when I'm working with students, I'm really teaching them it's okay to be angry, but it's what you do with that anger where there can be good choices and bad choices. So this is where social emotional learning comes into play. And it needs to be for both students and staff. Go ahead and advance to the next one. And there's really those 5 key areas of the social emotional learning. There is the self-awareness, there is the self-management, there is social awareness, there's relationship skills, and then there's responsible decision making. So in each of these areas, this really underlies resiliency. I mean, that's really what resiliency captures. So what I want to do is to quickly provide some of my favorite resources for schools to be able to utilize to actually integrate social emotional learning within their comprehensive framework. So one of the first things is it's really what are those things that we can do to strengthen internal resiliency. So all of these things, and go ahead and do the multiple clicks here, All of these things that you see listed on this slide strengthen internal resiliency. So that helps individuals feel like they have a sense of control over working through some of these challenges. While we may not be able to control everything that's going on out there, what we can control is how we choose to work through some of these challenges. And so by strengthening this internal resiliency through social emotional learning, what we know is that they work through stressors much more effectively, and we mitigate some of those long-term negative consequences. But also, in addition to building those internal resiliency pieces, go ahead and advance, there is the external resiliency. And this really is all about relationships. And so we know when they feel connected to their school, they feel engaged. We have, supports in place for both our staff and our families. We're facilitating those peer relationships, and they have access to positive role models and connecting with those pro-social institutions. And yeah, that connecting looks a little bit different now because some of that has to be through virtual platforms, but that connection is so important. So when we talk about mentally healthy individuals, it really is balancing the internal and the external resiliency. In regards to staff members, we really need to be focusing on what are some of these new opportunities. Now, one of the things that we have seen in schools is while there's been a lot of challenges to remote and virtual instruction, there's also been a lot of positives. For some kids that were too hesitant to speak up in the classroom, we're actually seeing they're more engaged virtually, okay? By being able to have some, of the office hours that some of our teachers are having on days when there isn't virtual instruction, some students are showing up for office hours virtually that they wouldn't have necessarily come into the classroom for help, either because they weren't comfortable or could be they couldn't stay after school because they didn't have transportation to get home. So really trying to capitalize on the positives and the new skill sets. But we also, in order to develop those career sustaining behaviors, we really need to make sure that we have time for staff to connect in really fun ways. We want to make sure that we're also supporting their own mental health and social emotional learning. We want to do as much as we can, and this was where our school-based mental health and community mental health supports can come into play to really work collaboratively as partners to make sure that we're getting supports in place for many of our families and potentially even some of our educators. And really looking at that data. And for those that are not showing up to school, doing that outreach and really utilizing our mental health professionals and even some of our school resource officers that have positive relationships developed to do some of those home visits, obviously in a safe way with appropriate PPEs put in place, but to really reach out to some of these families. So these next slides that I have, because I'm not going to have a chance to go through all of these for you, but these are some of my favorite activities and resources. As I like to say, we don't have to reinvent the wheel. There are a lot of resources out there for us to integrate social emotional learning. And you actually have access to this PowerPoint. So you will have all of these. So these are, for example, there's some where there's 6-minute SEL lessons, there's bibliotherapy books. There's also a website on Black emotional and mental health. There's also for staff and parents, there are some great SEL activities, not only to do in schools, but for what parents can do at home. Then there's also some other additional resources in regards to activities that can be done. There is this ruler approach, which is a program developed by the Yale Child Study Center, where they're focusing on those 5 social emotional learning areas. Sesame Street has, for the younger kids, has a plethora of free resources that really focus in on SEL and mental health and really helping kids process through some of the challenges. And then there's a lot of resources on trauma-informed, trauma-sensitive schools. Then also CASEL provides some great resources. They also, and along with the National Association of School Psychologists, and then ASCA, which is one of the National School Counselor organizations, they also specifically have developed some resources around social justice and also the reintegration as we start coming back to an in-person learning environment. And then I also want to point out on the next slide that there are some specific resources, again, on universal screenings, some social emotional behavioral screenings. And then also NASP has an Ask the Expert webinar series, which is short webinars anywhere from 45 to 60 minutes that talk about not only academic things that we can do, but also those mental health aspects and programming that we can do within schools. And then the next slide also just covers some additional resources that really focus on self-care. If you can go ahead and advance it to the next one. There we go. Really focused on some self-care or those career sustaining behaviors. And then, as was mentioned, there's the Prepare School Crisis Prevention and Intervention curriculum. You can go ahead and advance it to the next one. There's an entire website if you're really interested in learning a multi-tiered approach to crisis intervention and recovery that really interfaces well with those other multi-tiered systems of support that we are using in schools. And then Safe and Sound Schools also has some great, fabulous resources. And they're actually going to be doing a conference next week on really focusing on a variety of areas with school safety. Okay. Then for the last few minutes I really want to focus on the threat assessment piece, because this has also become a big concern in the virtual environment. Now, I don't have time, go ahead and advance, to go through how to set up a threat assessment program. That's a whole different training. But many times people say, well, we're not doing threat assessment in schools because we're virtual. And I'm like, oh, no. There can still be concerns in the virtual environment. For example, this just happened a short time ago at the beginning of September, where a Colorado student was suspended for waving a toy gun during a virtual class. Now, according to his parents, he just picked up the toy gun and moved it, waved it in, but it obviously was shown through the virtual screen. The teacher reported it to the administrator, who then reported it to the school resource officer. Law enforcement shows up at the student's house, and next thing you know, the student is suspended. Okay, these are the kinds of things that we want to avoid. So now, while it is not okay to be showing a gun in a classroom, one of the most important pieces is there's the difference between making a threat and posing a threat. Before suspension was considered, the threat assessment process should have been done to determine, was this a serious situation or not? And if it was something that happened more accidentally, or we work with kids that do not always think through their actions, could this have been something that could have been used as a learning opportunity, and something like a restorative justice practice would have been more appropriate than going towards suspension? So the bottom line is, in regards to threat assessments in the virtual environment, and I've given you a couple really good resources to read up on that goes way more in depth than what I have time for, your process still needs to be in place, okay? But there's going to be a few things about that process that is going to tweak a little bit. And this slide shows you what are those 8 critical steps according to the U.S. Department of Ed, the U.S. Secret Service, and the National Threat Assessment Center that need to be included in every good threat assessment program. But now to the next slides, what we're going to do is I'm going to specifically just quickly summarize what are some of the key differences of how this looks in a virtual environment. The bottom line is state laws still need to be followed. What we also needed to do a better job with was having some direct instruction with our students around what is acceptable and prohibited behaviors in the virtual environment. Just like we do with academic instruction in the classroom through positive behavior supports, we're setting those universal expectations. A lot of schools didn't do this on the front end, and that really can help kids know what is accepted and what's not. We do need to have a way to still for teachers to report those concerning and prohibited behaviors. And we need to utilize proactively our school mental health professionals to be providing social emotional learning lessons as part of the regular online class time. So instead of going into classrooms and doing SEL lessons, we can still, as school psychologists, counselors, social workers, we can join a regular education class and do that virtually. Okay, go ahead. Now, if you do have a concern that comes forward, then we need to continue to follow the process. But obviously, since we may not have access to the students and other individuals we need to speak to, physical access to them, we may need to conduct interviews or our, behavioral threat assessment team conversations in the virtual environment. So you do want to make sure that you have a secure video conferencing platform for your team meetings and also to potentially conduct the interviews. If the records are stored in hard copy in the school, someone's going to have to figure out how to get access to those educational records, but also making sure that we have virtual access to those. We still need to document efforts, how we attempted to get access to information, but maybe because of the unique circumstances we're in, there were those limitations. From a negligence perspective, what they're looking at is not could you have completely prevented an act of violence from happening. What they're really looking at is what did you do when you knew there was a concern, and did you have a thorough process in place and gather as much information and do as thorough of an assessment as you were able to do given the parameters of, of what we're currently working within. We also need to make sure that we update our law enforcement contact information because SROs now may be assigned other duties, so we may not have them to go to. So who is our local contact? And also we may be activating our community partners and our community members, for example, community mental health, to provide supports and follow-up that typically we would be able to provide if we were in person in schools. But we still can also, in regards to the intervention and the management piece, we also can still be involved with this, and we should be involved with this. We're still responsible for providing services. So if you have an individual that has a legitimate concern, we can still be doing virtual check-in with them and their parents. We can, on school issued devices, we can still monitor some of that internet activity. We want to make sure that we have teachers that are monitoring their schoolwork and their chats as they're doing virtual lessons and bringing that forward. Really working with parents on how to provide guidance and supports, while we're in the virtual environment. Oftentimes what we see with many of the more concerning cases, the family is also under significant stressors, and that's what's contributing to the concerning behavior. So what can we help put in place for the family? Also, if there are intended targets, we want to make sure we help them reduce their social media presence. Kids don't realize that if you have someone who has a grievance against you and all of your friends are tagging you in photos, well, that potential person now knows where you are, who you're communicating with. It makes you an easier target. So again, really doing some of that, that education with those intended targets. Involving law enforcement for home visits. I mean, obviously now with many of, the violence that we've had around social injustices and so forth involving law enforcement, you want to be careful about how you do this, but I also know so many awesome school resource officers that have amazing, amazing relationships with their students. And then, also in regards to mental health supports, we nowadays kids love their phones. There are actually a lot of good apps out there that if you're experiencing some depression, you're experiencing some anxiety, you can pull up this app and it has some coping mechanisms that it reinforces. It is sending positive messages. So there's also ways that we can help them through some of those challenges. So what I've provided here, just to quickly summarize, is also some threat assessment resources for you, and definitely take a look at these specifically. We do have, we have one on, right here, the NASP COVID-19 and virtual resources is where we have a specific handout on best practice guidelines in establishing threat assessment, which I know Florida has a law that you need to do that, but we also have a separate handout in what does threat assessment look like in the virtual environment. Okay. And then this is one of my favorite quotes, but this was actually in a Castle publication, so this is not one that I found. I borrowed it from one of their publications, but it says, it's still possible to prepare for the future without knowing what it will be. But the primary way to do that is to attend to the quality of the relationships, to how well we know and trust one another. So the bottom line with all of this is it really does come down to connectedness and relationships. And that can be built by everything that we are talking about today. All right, and there's my contact information. So that was a lot of information in 30 minutes.
Thank you, Melissa. You provided a wealth of information. We have a question in our chat box. This comes from Lisa D. Many teachers really are stressed and exhausted, appearing to have an overactive stress response cortisol release ongoing. What are some concrete things we can do during the school day to build staff and admin social emotional supports and knowledge to support teachers who are back in the classrooms experiencing ongoing stress due to COVID and other factors? Some may be having trouble with co-regulation skills with students, which we know is needed in order for kids to learn self-regulation skills.
Yeah, I think one of the first things that we can do is actually to educate our teachers and administrators on stress responses. And because many of them are high achieving and feel like they have to accomplish it all, and then they wonder what's wrong with me and why can't I manage this better, and then they become really hard on themselves. So I think the first thing is providing education around stress and stress responses. Also, the trauma-informed, trauma-sensitive approaches have some great strategies in there that they can implement within the classroom, not only to help themselves, but also to help their students learn. And I think the other important piece is it goes back to the human connection. You know, as school mental health professionals per se, just sending an email to teachers, or, you know, if you have, you know, connection with them via text messaging or another platform, hey, how you doing? Just wanted to check in and let you know I care. If you need anything, let me know. I was talking to a couple other teachers that because they're back in this hybrid model, their principal brought in an ice cream truck. And they're like, you have no idea, just at the end of a long week, what a big deal ice cream was for us. And we were kind of joking how we get nothing in education. So it is amazing what a bagel, ice cream, or coffee free does for all of us. You know, also really emphasizing the importance of setting boundaries. And so administrators telling teachers, you know, I do not want you checking your email after certain hours, or you need to limit checking it on weekends. Giving them permission to set boundaries is huge. And I think too, administrators need to model that, because if administrators are modeling the setting of the boundaries, it gives teachers better permission to do that, and giving them permission to go do some fun stuff. I also know of some schools that are doing like virtual happy hours. They're also getting on FaceTime and taking walks together, even though they might live in different neighborhoods, and they have the phone out doing FaceTime. So also any of those kinds of fun activities that we can help teachers do, I think can make a big difference.
Thank you, Melissa. Thank you for your presentation, and wow, there's a lot of resources that you provided. I'm going to save my doctoral question for you for the Q&A, because I definitely want to ask you a question regarding school threat assessment, suicidal ideation, and homicidal ideation. But I'd like to introduce Dr. Don Kincaid so we can hear from him, and then we can give you some time to think about what I might ask you. Dr. Don Kincaid is a professor in the Department of Child and Family Studies at the University of South Florida, and he co-directs the Florida Center for Inclusive Communities, a university center for excellence in developmental disabilities. His professional interests include the areas of person-centered planning, positive behavior support, disabilities, and school and system change. He is a primary investigator or co-primary investigator on a number of positive behavior support projects, including all of the following projects integrate school-based positive behavior intervention and supports within a multi-tiered support system framework. Much of his professional activity includes coordinating systems change efforts at the local, state, and national level to support the implementation of evidence-based practices. Additionally, he serves on a number of editorial and advisory boards in the area of positive behavior support. Dr. Kincaid came to PBS project from West Virginia University, where he served as the deputy director of the university-affiliated Center for Developmental Disabilities for 10 years. While in West Virginia, Dr. Kincaid directed a number of state and federal PBS projects, including the Life Quilters Project, the Tri-State Consortium for PBS, the Regional Collaborative for PBS, the Lifespan PBS Project, the School-Based PBS Project, and the Crisis Intervention Network. Welcome, Dr. Kincaid.
Thank you. It's good to be here. And I will start by just saying an amen or an amplification of the comments that Drs. Wiest and Reeves have shared. I have some of those same comments in my presentation, so we may move through some of those fairly quickly, but I want to talk to you about the integration in a multi-tiered system of mental health supports within the existing frameworks that schools already have. I hope I can give some examples of what that looks like at each of the tiers, so you can begin to see how do you take mental health or behavioral health concerns and needs and address those within established PBIS framework. So those are our goals for the day. First, to start with understanding the need and then moving in through understanding how PBIS can support that need. As has already been shared, maybe 1 in 5 students, maybe more than that, are not receiving the kind of mentor or behavioral health supports they need, and schools are clearly the setting for where most of that can be provided in an effective and efficient way. So next, here's just a few other things. As over half of the students that do have a mental health need are not receiving treatment. Youth with behavioral disorders require or are not receiving clinical services, and students with youth and mood disorders are only receiving an 18 or 38% the treatment that they need. Traditionally, what we've done is to try to deal with mental health needs by remediating those social, emotional, and behavioral disturbances or needs among referred students. So students referred within a school system or outside of the school system within a community mental health agency. And our goal is, well, just those individuals that are identified, referred, get support. What we've tried to do, and what Mark has done a nice job of describing, is an ISF approach. And we'll talk a little bit more about that, but taking a multi-tiered public health approach where we're looking at how do we foster that social, emotional, behavior, and academic competence for students. And we're going to start by making sure we're addressing psychological well-being for everyone. We're going to start at that tier 1 level of providing support. And then how do we look at needs of youth that have elevated risk for academic, social, emotional, behavioral problems? And then how do we provide an overall change in the environment, the classroom, the school, the home, and the community, which will promote youth overcoming risk and challenges? And then we still have that remediation piece, that intensive support piece at a tier 3 level. But that public health approach is really critical. I really appreciated the comments of Dr. Reeves about it's not just the pandemic producing trauma, but it's producing stress. Stress and trauma are not always the same thing, but for some students it is trauma, and for other students it's just an additional source of stress. But what we've got to do is we do know how to increase protective factors. We do know how to address and support students, even if it's virtually or on face-to-face work or in a hybrid model. Within schools, we know how to do that and know how to do it more effectively. Next. One of the things we developed a few years ago in Florida was looking at the idea of complete mental health within a school system. And we want to produce and promote strategies and practices that reduce risk factors, but also promote the presence of resilience factors. And I think it's part of what we really wanted to embed within our PBIS work, is to look at not only are we going to reduce disruptive behavior and change and remove unsafe settings and making sure we have addressing the fact that rules and expectations may not be consistent, but we also want to say, how do we build in teaching students appropriate social skills and how to build social relationships, how to have strategies to be happy, and to build those resilience factors. So we've looked at doing both of those within our PBIS work within Florida and across the country. Next. So why do we do this in schools? I think we just started in with a discussion that, well, we do this in schools. Maybe we need to talk about why we do it there. One of the reasons we do this work within schools is that it is the setting for a universal level or a tier 1 support for all students. Students are all together within those schools, either virtually or face-to-face, and it's the place to provide basic overview training and mental health supports and strategies on youth mental health first aid or other approaches that might support all students in understanding mental and behavioral supports and needs. It also provides the perfect opportunity for generalization and maintenance within a school. You think about teaching students to engage in social interactions, as we discussed earlier. One of the things that was very difficult in the lockdown was social interactions. But how do we get virtually or face-to-face with students opportunities to practice and learn and engage with other students? Well, that's going to happen during school. That's going to be the primary place where students will learn the skills of interacting and generalizing those social skills and mental health supports. It's also a place that's easily accessible by schools, at the school, by families, the community, and by youth. We've had districts that have told us when they look for intensive support needs for students that have those needs, they've sometimes had to put students on a bus and take them across county lines, district lines, to a mental health center because they weren't building and developing those supports at their school level building. So that school is the focus of the community and where students and families can receive support. It's also important because when we focus on the school, we have the capacity to reduce that stigma. We can produce the awareness that's necessary, and we can provide high quality intervention. And that's the challenge that we have, is to do both of those. As Mark was sharing with you earlier, we may do very well with awareness, but are we delivering high quality interventions at a school level is really critical for us to consider. And also to realize that mental health is a precondition for learning. If we don't address mental health needs of students, we're going to have a very difficult time with a learning environment being effective. Next. One of the things we did a couple of years ago is when Florida was rolling out some school-based mental health services and trying to enhance those with additional funding, additional practices and approaches and systems, we developed a triangle that told and tried to communicate what would those look like at tier 1 and tier 2 and tier 3. But one of the things we wanted to make sure was clear was, it's very small print, but it's over on the left. There had to be some foundational pieces in place. You had to have leadership team. You had to have effective data systems. You had to have strong universal implementation of PBIS and other types of strategies. You had to have that school, family, youth, community collaboration that Mark was sharing with you. You had to make sure you brought evidence-based practices, not just things that were flashy and attractive, but also things that we knew worked from research. And finally, we had to have a real clear understanding of what kind of professional development needed to occur, so that teachers, administrators, support providers within school knew how to operate within an environment that taught, reinforced, addressed mental health supports across all 3 tiers. Next. So I'm going to start with the tier 1 level and give you some examples of what that looks like. So at the universal tier 1 level, we promote mental health supports by looking at building competence for all students as well as prevention for all students. So some of the ways we do that is that school-wide PBIS and social emotional learning, melding together those supports and considering positive psychology. We also use classroom data to tell us where we might have some targeted needs. Do we have students that have internalizing and externalizing behaviors? Do we have classrooms that need additional support? Do we have problems with overall school climate. So how do we develop use our school-wide positive behavior support system or a social skills curriculum to really produce a school-wide program that might target social skills or responding to bullying or anti-bullying. We can also look at school-wide practices around specific skills, anti-bullying, peace builders, and again, it's about providing direct instruction, support from adults to peers and to the adults, modeling the skills that we're talking about. Let's look at some examples of what we're talking about here. So with universal mental health promotion, what we're talking about is how do we make sure we bring together the best that we know from social emotional learning, positive psychology, and school climate, including PBIS, to make sure that we're targeting and utilizing trauma-informed practices. How do we make sure that we are providing supports that will produce strength-based results for students and reduce stressors? Next. One of the things we want to do in positive behavior supports is to make schools more effective and equitable learning environments for all students. So what that means is if we're going to have trauma responsive schools, we have to have schools that can create environments that are predictable, they're consistent, they're positive. We can't have punitive, negative environments for students because that will just build on the trauma. They have to be safe and they have to be equitable. A couple of comments about that is to think about the idea of safety. We had a couple of comments earlier about safety within the pandemic, within hurricanes. I do remember a time about 10 years ago when we had 3 hurricanes crossing the state at the same time. We had lots of schools that lost their building and many of their communities were devastated. We just had one last year in the Panhandle. But what we've heard from many schools is that they found that their PBIS system was very essential for them to come together to address mental health needs of the students, as well as provide a safe environment. You know, things weren't working in the communities, homes were not working, electricity was down, but students knew that they had safety, they had a predictable, consistent environment at their home, at their school because of the PBIS system that was in place. But what we have to do is to make sure those things are trauma informed. So we want to teach behavior. We want to teach appropriate behavior through PBIS. We want to build on the family and the students' culture and expectations. One of the things I think we've not done a great job with until the recent work with ISF and mental health is I think we were too rigid. PBIS teaches rules and expectations, but I think we've learned a lot in the last 10 years about how we want to build on the strengths and assets of a student and as well as on the community itself. How do we adapt what we do to the values and beliefs and traditions of the families and the communities that each school lives in? Well, we do that by looking at how can we make sure that what we do in PBIS reduces reactionary procedures and practices. We don't want to get into punishment. We want to reduce those instances as much as we can within schools. We want to build on positive relationships. I mean, positive relationships between students as well as between staff and students is one of the most important predictors for success of students. We want to create that safe and nurturing environment. We want to produce and promote mental wellness, and all of those things have a direct impact on academic success. You're not going to have academic success if you're not addressing mental wellness, behavioral support, those kind of issues. And we also can promote attendance. Students want to attend schools that are positive and pay attention to their needs, not just behavioral or academic, but also social emotional. In fact, we find that schools, not only students, but we've found schools that have implemented effective PBIS strategies have teachers and administrators that want to work there. They become a focal point. They became a target school within the district that everybody wants to attend and work in. Some examples we have of from the past are just some examples of protective factors. This is from the National Research Council and Institute of Medicine over 10 years ago, but they point to some things. You can click through a few of these that will show us that we have positive teacher expectations, clear expectations for behavior, developing relationships, making friends. Those are things that are important protective factors. And those are things that a PBIS system needs to be able to do, not just expectations, but also teaching and supporting the SEL component of teaching social skills, teaching emotional support. Next. So what we do in this process is to clearly look at Tier 1 expectations and rules and routines, and how can we make sure that we're clarifying that schools need to have practices at Tier 1 that are trauma informed, that we're building safe and predictable environments so that those relationships can thrive and grow. At Tier 1, those expectations are, again, all environments, all people. Where do we develop rules that are unique to each setting of the school? And how do we look at certain routines that need to be done consistently and effectively so that they produce appropriate behavior and reduce trauma and stress for students and staff? We can do that, and one of the things I think we've done really well, and I'll share a few examples, are how we have embedded mental health concerns and issues within teaching expectations and rules and routines. Next. So here's an example of incorporating social emotional competencies within a school. You can see that some of these are very traditional, kind of respect, achieving, organized, roar. These are the school-wide expectations. Well, things like being on time are kind of traditional. That's a behavioral marker that we want to put into place that in all settings. But we also want to see assume positive intent. You can see that we're teaching those social emotional skills and requiring that across all environments. Hands and feet to yourself would just be a basic rule in all settings, but we also want to talk about helping and sharing and caring for one another. Be prepared, be responsible. Again, another rule that we would normally look at, but we've added to it recycle. So we've not just social, emotional, and behavioral, but also ecological needs that have to be addressed within the system. You can see a few others on down the, you can click on a few of those because I think they highlight them. Nope, go back one, please. So you can also see that online in this COVID time of remote learning, we're also seeing that we've had schools that were very good at beginning to redefine their respecting, responsible, and achieving and organized is to consider other people's feelings before you post, reread a message before you post, double check your sources, think before I forward, all these kind of things that we're teaching students some ways to address social emotional competencies, not just in all settings of the school, specific settings of the school, or even online. Next. So here's another example of a school-wide integration from Douglas Prep. And I like this example because, again, it is a nice implementation piece of social emotional. You can see some of the blue things within there are some of the rules that are addressed, but also things that are about social emotional health. Ignore distractions, interact with peers, ask for help when needed. They even have an entire section on the right, which is we want to teach coping skills. We've overlaid our school-wide expectations and social skills, and we have an entire section on coping skills. Here's what you do if you're going to be safe, if you're going to work together, if you're going to be responsible. Here's how you do that. I like the last line too, which is the first three things are what are students going to do? The last one is what are staff going to do? What are we committing to do to support social, emotional, and behavioral health of students as an exemplar? So this provides not just guidance for students, but also guidance for all staff at the school. Thank you. Another example of just very simple little diagram for younger children of thinking about how they're feeling in certain routines and the expectations of those routines, and just some reminders. They can take a break, talk about their feelings, listen to adult, count to 10, go for a walk. Some strategies that we're trying to teach, again, for self-regulation, self-management, and self-awareness. Go ahead. Also, in some of our schools, we've been seeing a much more use of mindfulness and how to engage that at a elementary, middle, and high school level, so that students can begin to use some of those strategies that we found so effective in mindfulness and yoga and other approaches to produce calmness, but also to center themselves for the work that's going to occur each day. Go ahead. Here's an example of PBIS prevention from Midwest PBIS's trauma crosswalk. What they've done is to really take each one of the strategies that we utilize within a PBIS system, such as define school-wide expectations, teach those expectations, divide a feedback and acknowledgement system, and describe what the strategy is, but also how that strategy can impact students that have been impacted by trauma. So what can we do to make that work better for those students? So for instance, looking over at teaching expectations, it's probably hard to read, but you can look at these a little later. You can reteach the behaviors and social skills, providing consistency. It's highly important for students impacted by trauma, as you want to make sure you're not punishing them. You want to provide as much reinforcement as possible in a positive environment. Next. We have some further ones of clearly identifying problem behaviors and discipline policies and making decisions. A couple of things is under discipline practices is we want to establish proactive, instructive, and restorative procedures that will create predictable policies that the adults will use in the school setting. Those practices will allow students to feel empowered and will teach skills rather than focus on consequences. So one of the underlying themes of a PBIS approach is we're teaching skills. We're teaching skills of school staff and administration, as well as of students. We're teaching social, emotional, and behavioral skill sets that are important for success within school, but also later on in life. And we want to avoid negative consequation for problem behaviors because it does not teach appropriate skills. It may punish a problem behavior, generally not very effectively, but it doesn't teach a replacement behavior. Next. So looking at another example of that is to take those same approaches at the school-wide level and say, what does it look like at a classroom level? How can we have a trauma-informed classroom using some of the PBIS basic ideas? First of those is to consider an organized, orderly physical environment. We've got the expectations and rules. We've defined and taught those. We have active supervision. And the last one is we provide specific praise. And it's a tool for building that student's self-esteem and a positive sense of self. So again, we're using these basic strategies for PBIS, but identifying the fact that we can deliver them and have to deliver them in a trauma-informed manner. Next. One of the things that we've done also in this in our state is we've trained and have nearly 2,000 schools that have been trained in PBIS. And as Mark was saying, we have nearly 30,000 schools doing PBIS across the country. We've in the last year revised our training. If you've been a PBIS school that got trained sometime in the last prior to the last year, we've got new material. We've got new information that includes mental health supports, includes much of the information we're sharing with you now. It's intended to reduce trauma. It's intended to build relationship-based discipline. It's intended to provide a culturally responsive practice for PBIS. So we have that training available and are delivering it now to Florida schools and across the country. But we also will be providing some self-paced modules on our website for schools that have been trained in the past, and those strategies may not have been present or may not have been as evident as they need to be. So when we think about what we want to do with PBIS, here's some ideas of things we want to avoid. We want to avoid isolation, restraint, minimizing or ignoring responses, allowing abusive behavior to occur, inconsistent rule enforcement, and having policies with no opportunity to question. So what we want to do with PBIS is to change that. We want to make sure that isolation, restraint, we want to build social skills, have students included and connected. We want to make sure that we're not ignoring responses, that we're responding to appropriate behavior, and that we have a way of providing effective responses, restorative responses to problem behaviors. We want to make sure that we're having sets of rules and expectations at the school that are being enforced consistently by all staff and by all administration. And we want to make sure we have student, family, community voice in everything we do, so that we don't have policies that are and practices that are in place, but with no opportunity to question whether they're effective or whether they're even appropriate for the community and the culture that we live in. Next. So what we do is to make sure that teachers know what they're to do in the classroom, and that office, principals, administration knows what they are to do, and that we also know how we respond to crisis incidents. But we want to also make sure that we're doing that with providing teachers with very clear guidelines and administrators with very clear guidelines of alternatives to punishment, alternatives to sending the student to the office or suspension. PBIS will provide those teachers, those administrators with better strategies that are instructional and positive to address consistent problem behaviors. Next. For instance, we would teach teachers and faculty and administrators to understand behavioral escalations and what to do with those, how to address problems before they become severe within a classroom setting or in addressing a debriefing situation with a student. Next. We have lots of resources that are available for Tier 1 mental health promotion within PBIS. We have lots of resources on our Florida PBIS website. We use a live binder to provide all kinds of information about mental health, PBIS, and data guides. Next. As Mark was saying, what we want to do within Florida and across the country is making sure that we, within a multi-tiered system of support for behavior or for PBIS, and I want to say, if your school is not doing PBIS, we're talking about what is the overall behavioral support system that your school has. You may be doing some of the components or all of the components, you're just not calling it PBIS. That's fine. We want to make sure whatever you're doing, does it work? Are you doing it consistently? And can you embed mental health supports within that process to produce that integrated systems framework? Okay. So real quickly, thinking about the next tier at a targeted intervention level, we really want to minimize the risk for students with specific needs. We want to make sure we're teaching appropriate skills. We're using data to progress monitor. We're identifying probably at a Tier 1 or early Tier 2 level those students that need additional support. And we're providing some interventions that may be group interventions or some that are fairly simple interventions that are very effective, such as the check-in, check-out program. Here are some examples of programs. We're not saying that these are programs you must use or should use. We're simply saying, as Mark was sharing earlier, there are some wonderful programs that are public domain. There are some wonderful ones that can be purchased. We want folks to make sure they're developing their Tier 2 system with not just looking at delivering lots of programs, but that they're looking very much at the system that needs to be in place. The system needs to be able to identify students. It needs to have a data system. It needs to have a way of implementation fidelity, measuring that across the programs and supports that are being provided. It needs to connect with families and the community. Those are all things that would happen within a Tier 2 strategy. Next. Here's just an example of a very simple Tier 2 strategy where you've added in social emotional wellness skills. So for this daily progress report for a student, the expectations, this might be in a check-in, check-out program, but it could be in a social skills training program where you might use a very simple data system. But what you've done is to be safe, be respectful, be responsible, but you're asking for the student to engage in self-management strategies, like use a calming strategy, do a self-check, use your words, ask for help, connect with a safe person. So these are where we're teaching those kind of skills within that standard approach of data collection and tier 2 system that we would have in place. Now at the intensive level, I think one of the things we've learned in the past is, and it was raised early on in a discussion, well, are we only talking about students with IEPs? No, we're not. I think it's important for us to realize that tier 3, we're talking about students who have chronic needs. They are not able to be addressed very easily through a simple program or a delivery of a couple of tier 2 interventions. They need more intensive supports. Some of those can be addressed through ongoing interventions that are developed as part of a functional behavior assessment and a behavior intervention plan. But we want to make sure folks understand that that's not all that's necessary. There are other strategies such as a check and connect and individual therapy and cognitive behavioral therapy and family focused interventions that can and should be delivered. And those kind of interventions can be delivered within that community collaborative model that Mark was talking about and should be. And I think an important point that he made was that it's not a question of having a PBIS system in place and bringing lots of consultants and therapists into the school. It's about how do you build that system of support so that they're working together? How do you have those collaborative relationships? How do you make sure that you have cooperative agreements so that you can provide supports to all the students that have intensive supports, but also the students that don't have intensive? How could a therapist provide support at tier 1 by providing overall training for students and helping out with some of those teaching of basic skills that are necessary? Next. What we want to ask is, in our multi-tiered system of support, is at each of the tiers, who's receiving services and where is it occurring? What services are being delivered? Are they evidence-based practices? Are they being done with fidelity? And is it working? If what you're doing is not working, then there are questions to ask, such as, do we have the right intervention? Do we have the right system in place? Have we identified the right students? Those are all things that cause us to engage in problem solving that's effective within a multi-tiered system of support. Next. We have a couple of resources to share with you. One of those is on our Florida PBIS website. We do have a mental well-being live binder for teams, and we have a skill development modules on integrating SEL and trauma-informed practices into a PBIS framework. So this is a way for you, if you've gone through PBIS training or you are a PBIS school, you can look and see how can we enhance what we're doing with understanding SEL and trauma, and how do we develop some changes in our system to make it more responsive. Next, just our contact information, and thank you very much.
Thank you, Don. Personally, I think it's exciting to see the morphing of PBIS to include so many positive aspects of mental health, children's mental health, and to hear about the new and exciting rollout of the training that PBIS is providing. I had a question as I listened, and there is not a question in the chat box, so you're going to be subjected to my dissertation type question here. So as I was listening, and I am so excited to hear all the positive changes with PBIS, but I really see that it's coming together with a system of care, the same guiding principles appear in PBIS, and I wanted to know what your thoughts are on that.
Yeah, I absolutely agree. I think at our tier 3 level, in fact, we advocate a tier 3 model for students that have intensive needs, doing simple, more complex functional behavior assessments and behavior intervention plans, but also a wraparound system of care approach for those students that have very intensive needs, and those needs that may need a community of support. These are students that might be involved medically. They may be involved with criminal or juvenile justice. They may be involved in substance abuse as well as behavioral issues. Those students need that wraparound, that type of community of practice approach. If we don't do that, then I don't think we're going to be able to address all the factors and all the issues to support those students. We really can't just assume that we can do a one-size model for all students that have intensive needs and think it will work.
Thank you. I'm so excited just to hear all the positive things happening with PBIS. Thank you for sharing. I don't see any other questions right now in the chat box, but I would like to take a moment to introduce Dr. Kathleen Moore. She is a research professor at, and executive director of FMHI, the Florida Mental Health Institute, in the College of Behavioral and Community Science. She's been involved in community-based research and policy in the area of mental health and addiction for the past 20 years. I'd like to welcome Dr. Moore. She is our, she has been the lead in getting our colloquium together and inviting us all to do this, and we are so excited to have her with us.
Thank you so much, Nikki, and I just want to say a couple of brief words before we get into our panel Q&A. Thank you so much, everyone, for attending this informative virtual colloquium on school mental health. We know that you're all very busy, and so we appreciate you taking the time out of your day to attend this worthwhile event. I also want to acknowledge our presenters, Dr. Mark Wiest, Dr. Melissa Reeves, Dr. Don Kincaid, and a big thank you to our moderator, Dr. Nikki Zen. Again, you all have taken time out of your morning, and we've had multiple run-throughs with this colloquium, so really appreciate the informative and thoughtful presentations that you've given this morning. I want to also thank our Dean Sarovich, and everyone behind the scenes to make this virtual colloquium be successful. As we move into this virtual world, I know we'll be doing more of these, and it is exciting that we can do this colloquium not just locally, but also statewide, nationally, and even internationally. So we really appreciate everyone behind the scenes working so diligently on this colloquium. And finally, a big thank you to Dr. Carl and Cynthia Hawkins for continuing to support our fall colloquium. We really appreciate it and look forward to our colloquiums in the future. As we stated in the Q&A, we'll be posting the PowerPoint presentations and recording, and we'll send out the link to all those registered attendees to your email probably early next week. There's also information on CEUs, and that's been posted in the Q&A. So we hope that you'll be able to stay for our panel Q&A discussion with all three of our presenters. Both Nikki and I will be moderating this event. And Nikki, why don't you, if you want, why don't you start us off with the first question?
Sure, I'd like to actually, Don, a question came in for Don as we were transitioning. So Don, if you'd like to take the first question, how can you explain the difference between SEL, and mental health needs to school staff? Don, you're muted.
Sorry about that. What I shared was just amazing a minute ago. I'll start over again. So what I would share is that I think it's important for folks to understand that traditionally we've looked at mental health needs of a group of students, and those may be students at a tier 3 level. I think the important thing we want to do with social emotional learning and behavioral learning is to make sure we're broadening that in a multi-tiered system of support. That we're teaching, we want to talk about teaching skills to all students about self-regulation and dealing with stress and mindfulness or any of those sets of skills. And I think in the past, we've tended to think those are relegated to students who have intensive needs. And I think what we want to do is to build more of an awareness that we need to have those prevention approaches, not just for students, but also for faculty and staff and administrators at schools, as well as families. We all need those kind of supports at this time.
Thank you, Don. Did someone else want to jump in? I guess if you don't mind, I'll also add in for Julie's question, really looking at SEL, social emotional learning, really looking at those executive functions that all children need is very important when we're thinking about, and mental health is about mental wellness, not just about mental illness. So remembering the importance of prevention and intervention to prevent illness. One of the other questions that we had done for you are any advice or recommendations related to the implementation science of PBIS? For example, staff buy-in, connection to resources, etc.
Okay. I didn't plant that question in the group, but I think it's a very important one. And I think Mark is aware of that from his work with our PBIS Center. PBIS is not a practice, not a program. It's not a conglomeration of practices and programs. It's a framework. And I think that systems approach is what's made it effective. That system of having teaming, having buy-in, communication, building data systems that you can use for problem solving. All of those components we need to put into place allow you to implement different practices, different strategies based upon the age of the student, the location of the school, the needs of those students. So it's something that framework provides that flexibility and the foundation for what you want to do for SEL and other mental and behavioral health supports.
Thank you, Don. Mark, there was a question for you that came in after we transitioned. And so if you could tackle this question that came in from Donna San Salvador. I have long thought that teaching kids as early as kindergarten some basic coping skills and techniques and continue to expand through high school. Any idea if this is possible or if it works or in the works?
Sure, I think Melissa may be better able to answer the question, but there are SEL programs that start very young. One that I think about is promoting alternative thinking strategies that would fit the bill for teaching those kind of skills. And there's another one called Paths to PACS, which combines that program with a good behavior game that teaches children those kind of coping skills beginning at a very early age. But I would defer to Melissa. I believe she's more of an SEL expert than I am.
Yeah, actually, I mean, just to piggyback off that, there's definitely programs that you can take that go from preschool all the way up through high school, but it's not so much about are you using the same program at every level. It's more about are you continuing to reinforce the critical skills that are aligned with SEL as they progress up through the ages. And I will say, you know, schools are really good about elementary does this, middle does this, high does this, but are you having what we used to call in my former district vertical planning meetings? So we would actually have meetings between the elementary schools to their feeder middle schools to their feeder high schools, and we would talk about our, you know, bullying prevention program, our SEL initiatives, the PBIS, and we were able to come to a consensus on what are those key skills we want to teach starting in preschool, then how do we continue to build upon those skills in elementary, middle, and high, and also use some of the same language. So there's consistency. Now, granted, we have a lot of schools where there's high mobility rates. So kids may not always be in the same district they were in from preschool all the way through high school. But irregardless, you know, when they come in, there's that common foundational skill set that is continuing to be emphasized. So, you know, there's certainly ways to do that using, you know, the overall frameworks, and then looking at how do we just continue to reinforce, you know, those critical concepts and skills from preschool all the way through high school. And that's really where we tend to see the biggest difference is we're reinforcing. The sustainability is absolutely critical. One-shot trainings in a classroom with kids do not do it. You've got to have that ongoing reinforcement of the skill set throughout where it becomes part of your universal programming.
Thank you. Melissa, I have a question for you as you didn't get to answer one earlier. The question is, what do you believe are 3 basic building blocks that are required to prevent, mitigate, and address suicidal, homicidal ideation, school threats, and to prevent tragedies such as those that we've experienced in our state?
Okay, The first building block, honestly, is prevention, using so much of what we've just spent the last couple hours talking about. Because when you are building those positive school climates and cultures, number one, you're equipping students and staff with better skills as to how to deal with the stressors. You are building positive relationships to where individuals feel included. And you're also building that people care about each other. So if you see someone who's struggling, or you see indicators of potential harm to self or harm to others, if you have those positive school climates going, individuals are going to feel much more comfortable reporting that to the adults. So then we can do something proactively about it. The other piece is that we need to have well-trained staff members and a good suicide assessment protocol and a good behavioral threat assessment and management protocol in place. And you need to have well-trained staff members in how to do that and do it the right way according to best practices. And those need to be seen as intervention approaches, not as punitive approaches. The whole goal of the suicide assessment is not only to save a life, but it's let's get interventions in place that help with the stressors. It's the same thing with threat assessment, but unfortunately, because schools don't have good processes in place, a lot of kids who make a threat, even though they don't pose a threat, automatically get suspended, expelled, or sent to alternative programs. So the reputation becomes, oh my gosh, the minute you do something, and maybe you were being what I joke when I do trainings, we do have individuals that fall into the YDS category. They're being young, dumb, and stupid and not thinking through, or things are taken out of context because you didn't take the time to work the process. And then it becomes seen as a punitive model. Well, students are not going to report concerns if they're afraid that they could be responsible for getting someone kicked out of school, if there might not have been any validity to the threat. Maybe it was, they were talking about a video game at the cafeteria table and the person who overheard it didn't realize that they were talking about Fortnite. So you've got to have, in addition to prevention, you've got to have well-trained teams and established protocols in place. Use the protocols, because if you do it the right way, that will guide you to interventions that are appropriate based upon the level of concern. And then the third component is having really good interventions and supports in place, because whether it's harm to self or harm to others, we know that if you can get the right supports in place, we can help that individual onto a better pathway. Ideations of harm to self and harm to other wax and wane, and are oftentimes dependent upon the current life stressors. We can mitigate those stressors, get supports in place. We can help those those individuals onto a positive pathway for the rest of their life. So it's the, prevention, the assessment, and the intervention. Really, those are the three key pieces that all need to come together.
Thank you, Melissa. I think for our next question from Abigail Atkins, Kathy Moore is probably more equipped to answer this question.
Thank you, Nikki. Yes, Abigail asked, can any of the panelists give an update on the Institute's model response team model protocol for use by school districts? That's when the state of Florida, when responding to student crises, developed to House Bill 945. So those of you that are attending, that are within the state of Florida, might know about this bill that was spearheaded by Representative David Silvers, and FMHI has been tasked with developing a model protocol for mobile response teams within the school system. We have been given a deadline to the end of October to develop this protocol. Nikki is working with me on this, as well as some other team members throughout our college, and we are diligently trying to work through all of the data that we've been accumulating, working with the managing entities within the state of Florida, as well as talking and discussing with law enforcement and mobile response teams as well. So Abigail, we should have, long story short, we should have a model, draft model protocol by the end of the month that we will be sharing with you, and we will be posting on our website. So thank you for that.
Thank you, Kathy. I have a question, something that Melissa brought up, but I'm going to ask all of our panelists. One of the points that you brought up was that there should be ground rules for our virtual environment, and explaining some of those prohibited behaviors. And sometimes we don't know what those behaviors are until they've happened. So what are some types of prohibited behaviors we would want to have as our ground rules in a school virtual environment?
I can go ahead and start. What I always recommend is build upon what students and staff and parents are already familiar with. So reinforce those exact same behaviors that you had when you were in an in-person learning environment. Then add on to that, what are some of the unique characteristics of the virtual environment? So for example, you should not be putting your teacher's picture up and putting memes and animations on it, which we've had reports of students doing, which becomes really disruptive. Just like you would not be allowed to bully or say put downs to another student in the class when you were in person, you are not allowed to be sending them direct messages, using a chat box or something like that in a virtual platform. Just like you are not allowed to bring facsimiles of weapons and so forth to school, you are not allowed to do that in a virtual environment either. So, if you have certain toys that you play with, and you could even say specifically like toy guns, some of you may play with those are not allowed to be seen in a virtual environment. And even as simple as, and I know this sounds crazy, but you don't come to school in your pajamas. For parents, you don't go walking behind your child in pajamas or not wearing appropriate clothing. And we've actually had incidences of that. Parents walking behind their kids holding a cocktail. It's like, no, you can't do that either. So, to me, those are kind of common sense, but you would be amazed. So I always start with the basic rules they're used to, and then be thinking about what are those unique circumstances of a virtual environment, and really spelling those out. And also ask the kids to come up with them. What are some things you anticipate could happen that are not okay, and bring them into the discussion about setting the norms for the virtual environment.
I would echo those comments. I think one of the things that is really critical is if you've got a school that already had expectations and rules established in the past, you don't want to establish an entirely different set of those for virtual. You don't want to have students, on Mondays and Wednesdays, they have a different set of rules than they have on Tuesdays and Thursdays if they're going virtual or live. But you can take each one of those expectations and say, here's what it looks like virtually. Here's what it looks like in the classroom. Here's how it looks like in the hallway. So I think we have a lot of resources on our website for the Florida PBIS project about resources for classroom teachers and for families in operating in a virtual environment. So I'd direct you to some of those as options to look at and some ideas to think about. But also I think having students provide feedback, I think we have students that are 6 years old that are sitting down in front of a computer and they're asked to sit there for 3 hours. That's not developmentally appropriate. So what are the expectations we're going to try to establish? What are the things we can do to mitigate the fact that we can't have a student sitting there for 3 hours? It's not going to work. So whether it's asking for a break or programming breaks or having the class vote on when to take a break, those are all things that can be done to enhance the virtual environment.
What Don and Melissa said.
Thank you. I'm going to ask another question, and we talked about how do we establish these virtual rules for the environment, but how do we provide support? My next question is, how do we provide support for our teachers and for our administration in this virtual environment?
Well, when we first, moved to virtual education last year in Florida, one of the things we did was to reach out to all of our districts and ask them what the need was, and also reached out to a lot of families and teachers to find out what they needed. One of the things they told us very clearly was they didn't need 3-day trainings. They didn't have the time. They were struggling. And so what they were telling us was, we need a 5-minute description of one strategy. We need a very clear articulation of what can we do in this situation. And I think that's what we tried to do, was to give them very short little vignettes and simple ideas that they can try in their classroom to address the differences they have. You know, one of the differences that came up considerably consistently by a lot of folks was, okay, we've got ideas of what the rules and the expectations are, but we had a recognition and reward system that we operated at our school and within our classroom, and it's gone now. What do we do? Well, we had to have all of our teachers begin to think of a way, how will you recognize and support students' appropriate behavior virtually? What can they do? And having them consider some things they'd not thought about before. For instance, okay, it's a great idea to say, you've been doing so great, we're going to give you 3 minutes, Joe, to tell a joke. Or you get to choose the next activity, or you get to some way of giving control and giving and virtually providing support to those students in recognition of the work that they're doing. Just attending and participating and being engaged within the school is really critical, and you have to be very creative in doing that. So we provided folks with lots of creative ideas.
Thank you. I think my next question is looking to the future, and we know that one day we will be in hopefully close proximity with each other again. But as we think about our current situation and the future, what are some innovative ideas or thoughts that either you or the audience has been thinking about? And I ask that because we have some researchers that are joining us who are leading innovative projects and research as we sit here and we speak. And so I would love to have those ideas and thoughts out in the universe so that people can actually start to think about answering some of our problems or coming up with some solutions.
Well, I'll take a shot at it. I think that as I mentioned, we have learned that aspects of virtual learning and telehealth can work. So I do think that there are opportunities to be more efficient going forward. As I mentioned, for our research studies, we're doing all of our group implementation support now virtually of necessity, but we think we will continue that going forward. So one thing that's going to be real, I think, is that we're going to have more funds available that used to be in the travel budgets that now we can use otherwise. I believe there's going to be a continued need for in-person, and I hope that that can happen as soon as the spring, but there will likely be less meetings. So we'll have less need for travel, and thinking about how we can reallocate those funds. So I think building from the progress that we've made around virtual learning and telehealth will really help us going forward.
Yeah, I reiterate what you said, Mark. I think we've got a lot of families that are, when we talk about the trials and tribulations of virtual learning, it worked really well for them, and it worked better for their child. I've got a colleague whose son did much better with virtual learning than face-to-face learning. And so I think what we've done is we've expanded the options and opportunities for people, and the different ways of trying to educate. And we've been forced to do it. Now we've got some experience doing it. I don't see us moving back to this is the only way we'll do education. I think we're going to be changed forever in terms of how we do education, how we have to deliver those kind of supports. And I think we've got folks that will get very creative and continue to think about how we do that into the future.
Yeah. And I think the key is going to be that the researchers can capture all of those things that are working really, really well, and what were some of those challenges that we found ways to work through. But I would agree, I've done a lot of training up in the state of Alaska, and their rule on all the time. And they said, finally, we have professional development opportunities up here that we've never had before because we can't bring people up here. We finally are, having other educators that are now doing more experimenting with the virtual delivery, and we're able to have dialogue on what's working and what's not working. So for them, they're like, we've been asking for this for years, but it was kind of, well, we don't really know how to do that, so we're not going to do it. And now we've been forced into it. So I just hope that through research, we can capture the ways to do it the right way, or to do it the most successful way. And then we can replicate that.
Mm-hmm.
Thank you. One more question before we maybe have your final thoughts. What are your thoughts about silos between school districts and community mental health services and supports, and providing that bridge? We know in Florida that that's been crucial and something that we're working on. But how do you go about making that bridge stronger? And so that's my question to you.
I can speak at it from more of the school mental health perspective. One of the things that I always like to say is, first of all, our partnership with community mental health is absolutely critical, because there's no way anyone can do this by themselves. And in most of the students we work with, if the students are struggling, so is the family in some way. There's usually also some resources that the parents and the family need. So those community partnerships are critical. Where we run into issues, and I should say challenges, is when community mental health professionals come into the schools, they're provided space, they deliver services, but then they can't talk to the school mental health professionals because of HIPAA and confidentiality. So then you don't have true collaboration and partnership going on, because we can't talk, or people think they can't talk. So as I say, when we have those partnerships, community mental health should never come into the schools and replace the school mental health professionals, nor do school mental health professionals replace all the incredible expertise that our community mental health professionals have. But what we have to do is we have to find a way to be able to collaborate and consult and work together with the children and the families that we're serving. And obviously release of informations make that the easiest way, but what if you have a family that is afraid to do that for a variety of different reasons? Are there still ways that we can collaborate and consult with each other for the greater benefit of the child? And I would say, honestly, our biggest is it's the communication around confidentiality that has been one of our biggest struggles. What I also will say from a school psych perspective, we have so many districts that still tend to only use school psychologists for testing for special ed eligibility, when we can do so much more than that. And we need to broaden the role of the school psychologist. We need to get school counselors out of just scheduling and move them into more of providing mental health services, so we can also do more collaboration with those community partners.
Yeah, and I'll just briefly say, I agree with all of Melissa's comments. Push the envelope further and have the memorandum of agreement basically specify that your community mental health clinicians are as if they are school employees. Eliminate artificial boundaries. Mm-hmm. There are many districts that are doing that. There's no exclusion from any meeting. There's no limitation on information sharing. Push the envelope on those MOAs.
Absolutely.
And I would comment and go back to a resource that Mark shared. The ISF manuals that are available are really well done, and the implementation one is exceptional in teaching a team or a district how to actually engage in this process to build those relationships. What does it look like? How do you do it? How do you engage in that planning process? I think when I've seen problems occur at a district level where they received lots of mental health funding, but they didn't know what to do with it, they did things like, well, we're going to engage in a contract with a psychiatrist. At the end of the year, the psychiatrist had billed for hundreds of thousands of dollars and had seen 2 students. So we've got to be very thoughtful about how funds are allocated, but also that we have a collaborative planning process that will result in really good outcomes for students.
Mm-hmm. Yeah, I also want to add that I agree with all 3 of you that the collaboration between in-school resources and out-of-school resources is vital, whether we're doing that in person or virtually. Working on this House bill within school mental health and seeing how some of those silos are created and trying to break through those barriers will be really important as we move forward. So agree with all of you. We want to wrap this up in the next couple of minutes. We know we're getting close to the end, and folks have been on for a couple of hours. We really, again, appreciate all your time and effort. If you have any lasting thoughts that you want to remark on about today's colloquium, that would be great. And as I said earlier, we'll be making the PowerPoint and the live recording available in the next couple of days. So if each of you want to just say a couple of words, and then we'll wrap this up. Thank you so much.
I think my final comment is if you are doing PBIS or would like to do PBIS within your school, every state has contacts, every state has resources that are available for them to access to do that. And I think we also have tons of resources at our Florida state level as well as the national level to address that integration with mental health. So I think we're well poised to support you in your journey with PBIS and mental health integration.
Thank you, Don.
Yeah, and I'll conclude it by saying, that the work that all of us do is so incredibly important, and even more so now. And just remember, it is really all about the collaboration and relationships and supporting each other. And this soon will end. I mean, COVID at some point in time will be over. We have other stressors that will continue to be ongoing, but I think what we know is that those collaborative partnerships is really what helps us continue to work through these challenges and to also stay focused on the positive outcomes that we have seen. But I would agree, I think we're kind of in a new normal. I'm not sure that we're ever going to go back, but I'm not sure that we should go back to the way things that always were. And so just to capitalize off what we've learned, but the really important piece is just continuing to support each other in building these skill sets.
I would just say this is one of the best virtual events I've done in quite some time. So congrats to the USF leadership for organizing it. And thank you again for involving me. I'm surprised Don didn't have pictures of his grandson in his PowerPoint, because I thought about having pictures of mine and mine. So we'd have had a grandson competition. But I knew of Melissa, and now I know Melissa better. And I'm definitely going to reach out to you related to our work here in South Carolina. So thank you all.
Thank you. Thank you, Mark, Melissa, Don, and Nikki. We really appreciate you taking the time. Everybody have a wonderful day. It's a beautiful day here in Florida. Hopefully it is wherever you are. And we hope to see you soon and look forward to our next fall colloquium. Thank you.